The House will come to order. Reports from the Committee on Rules and Legislative Administration.
Long from the Committee on Rules and Legislative Administration, pursuant to Rules 1.21 and 3.33, designates the following bills to be placed on the calendar for the day for Thursday, May 9th, 2024, and establishes a pre-filing requirement for amendments offered to the following bills. Senate file numbers 4699 and 4942, and House file numbers 5246 and 4984.
Calendar for the day. The clerk will report the bill.
House file number 4738, number 1 on the calendar for the day, an act relating to health, establishing an Office of Emergency Medical Services, the third engrossment.
I recognize the author from Dakota, Representative Huot.
Madam Speaker, this is the bill. What I'd like to do right away is get to the amendments and then come back after we get through with the amendments and introduce it in the form I want it in.
There's an amendment at the desk. The clerk will report the amendment.
Hewitt moves to amend House File number 4738, the third engrossment, and the amendment is coded A12-1.
Representative Hewitt.
Thank you, Madam Speaker and members. Basically, the A1 puts the bill in the shape we want it in. It brings in different things from the health bill. It also brings in basically the department and gives them direction on what we call the fly medic, the sprint medic, and tells them exactly where we want it to be put. The reason for this is that we do have a dysfunctioning department that had terrible audits that we have to actually pay attention to, and we got to give them direction because there'll also be a fiscal responsibility here with $6 million. So we had to draw out where these areas are. They were drawn out because A, they have response time issues. B, they also are going to be filling up this summer with many, many visitors. And so those were the two areas that we focused on. The other parts are what we're looking at that we heard on the task force we had last summer. This is low-hanging fruit. These are people that retired during COVID. These are individuals that we can pull them back and get their licenses renewed. So we're looking at where we can build the bench so our services get it. I would like a green vote on this amendment.
Discussion to the amendment. The member from Travers, Representative Backer.
Yeah, Madam Speaker and members. First of all, the second half of this bill does a lot of good things. I would agree with the author of the amendment. It's something that Representative Hewitt and I have worked on together and other providers. One of the things that it does, it gives flexibility for registered nurses to run in the back of the EMT, as an EMT in the back of the ambulance. Several services across the state, including mine, has challenges of putting people in the back of the rig. So that's a very good part. We're talking also in this, Minnesota licensed physician assistants would also, with some guardrails, would be able to also run in the back of the ambulance, of course, approval by the medical director. Because here's one of the things that we have to learn. A lot of the things over my 29 years serving as an EMT, you're not taught, you're caught. And nurses and physician assistants have caught a lot of things. There are several times that when we get into ER, myself, now it's about 80% of the time, doesn't matter if it's Graceville, Ortonville, Wheaton, Millbank, or Sisseton, we become the ER staff. So we know exactly a lot of the people that we work in the ER room because of lack of staffing, those individuals should be able to help us in the back of ambulance. This bill also has some good provisions on driving, flexibility. I'm a big believer giving local individuals the flexibility to make those decisions. Some of you members may know every single ambulance services have to run under a doctor's license. That's a medical director. That medical director, along with the service members of that service, knows best, not St. Paul. And that's one of the provisions that I like about this bill, because it gives that flexibility. It doesn't solve the problem. We have a bigger problem with, which I'll be discussing later, but it does give flexibility. Right now, ambulance is at a 911 situation. So thank you there, Representative Huot. If he was not going to put that, actually, I was going to have an amendment to add all this too, because it's something that we have worked together on. The first part of the amendment is of the sprint model, and it does designate some areas for the sprint model. And just for members, what that sprint model does, it puts a paramedic in a vehicle, and when the pager goes off, they're roaming the district, similar to like the state patrol concept. Not necessarily a bad idea, but you'll be hearing me later talking about other priorities that we need to address first. I know Grant County is mentioned in this. Grant County is already using a sprint pickup for this situation, so that's why you will hear me talking about possibly other priorities down. I would ask members to vote green on this, especially because it is working towards helping EMS. This is by far not a solution to everything, so I would ask members to vote green on this amendment. Thank you.
I recognize the member from Chisago, Representative New Brindley.
Thank you, Madam Speaker. Can I just request a roll call on this?
A roll call has been requested. Seeing 15 hands, there will be a roll call.
Thank you, Madam Speaker, and I'd recommend a yes vote.
Further discussion to the amendment. Representative Murphy.
Thank you, Madam Speaker. I just want to let you know that Ottertail County had a role in this project, and I met several times with Perham EMS and Perham Health, who is one of the big advocates and has a lot to do with EMS in Ottertail County. And they've done a great job of looking at this particular problem and coming up with solutions. Rebecca Hipsch is one of the leaders in Ottertail County, and she's definitely put together a program that I think will be well thought out and will deliver a lot for EMS. So I just want to make that comment. Thank you.
Any further discussion? To the author of the amendment, Representative Huot.
Thank you, members. Please vote green.
The clerk will take the roll. The chief clerk will call the names of the members voting remotely.
Carroll.
Carroll, aye.
Carroll, aye. Cagle.
The clerk will close the roll. There being 126 yeas and 0 nays, the motion does prevail and the amendment is adopted. There's an amendment at the desk. The clerk will report the amendment.
Backer moves to amend House Law number 4738, the third engrossment as amended. The amendment is coded A11.
I recognize the author of the amendment, the member from Traverse, Representative Backer.
Yeah, Madam Speaker, thank you very much. Members, what this bill does is, as several of us know across the aisle, what happens in greater Minnesota is not always the same as suburban Minnesota, and also not the same as in Minneapolis, St. Paul. So for example, we'll use sprint medics. Sprint medics would operate differently in a rural setting because of the lack of density of population compared to like when I did a ride along on February 28th up in Roseville and that neck of the metro area. So what this does is it tells the director in it when they are looking to adopt rules that they have to look and consider the effect of the rules compared to greater Minnesota rural ambulance services like the one I'm on, compared to a Metro one, which is generally ran by a hospital or fire department. So I would ask that we would vote green on that, just because there are differences. Because, for example, in my district, you've heard me several times, we run a volunteer service where generally a hospital-ran system in the metro area is a paid medic. You know, generally medics will get $32, $33 an hour. I get, I think, a whopping $2 an hour when I'm on call. Now, I'm an EMT, but it doesn't matter if I'm a paramedic or not. Our call would still get a whopping $2. So we're subsidizing the ambulance service, us volunteers in Greater Minnesota. So with that, I would ask for a green vote on it. Just that common sense, looking the difference between Greater Minnesota and the 7-county metro area. Thank you, members. Vote green.
I recognize the member from Dakota, Representative Huot.
Thank you, Madam Speaker, and thank you, Representative Backer. Again, you've had many years of great service to our state and to EMS. However, I'm going to disagree with you here. You and I have had the same exact training. When it comes to a patient that is down, we're going to do the same thing. Doesn't matter if you're in rural Minnesota or if you're downtown St. Paul, we are going to start the same algorithm, should I say. What really disgusted me yesterday was when Representative Keel stood up on the floor and was denied transport by an ambulance service. That was ridiculous, and I apologize for that. That just makes me mad. That's why we need to have uniformity across the state. That's why we need to make sure that what I'm held accountable for in a metro area, you also will be held accountable for. I don't think we need this metro-rural divide here. That has divided us too long in EMS and has to stop, because that's what shortchanged many of your districts, is that same thing. Representative Backer, I want to make sure you have the same services that Representative Nash has, one of the best ambulance services in the state. I want to make sure that we are going to continue to have that without, I get caught up so much about the rural metro mentality. It's a different thing. I'm probably going to run more calls than you are. But that's about it. When it comes to that patient, you and I in our training are going to be the same way. And that's what the regulatory arm is about, is to make sure that we get somebody there, they do the same thing, because continuity and care is a big deal. So I like the idea of a report, but if you look at the overall bill, we have a number of reports coming back to the House and the Senate health chairs. And I think we could probably have them request that if they're not looking at it with a rural lens. But I want to go away from this. EMS is about public safety. We're one of the 3 arms in public safety. And there isn't any of my colleagues on the other side of the floor that's going to deny that, because they brought it up several times this week. This is about public safety. Today's vote is about public safety and enhancing public safety for the state. So, Representative Backer, as much as I want to accept this amendment, I can't accept it because we have a number of reports in the bill, and I think that'll be suffice. Thank you.
I recognize the member from Isanti, Representative Johnson.
Madam Speaker, members, Representative Backer, thank you for this amendment. It's a good one. Now, I've been law enforcement, I've done fire department, and I was an EMT, been on the ambulance. In fact, 7 of my first 10 calls were CPR runs. I like this amendment. It's a good one. In my career in public safety, law enforcement and fire worked very hard to get things changed. Fortunately, with EMS and the ambulance, they didn't have to fight that. Now we're going to have to fight to keep it from changing. Because what happens in the greatest part of Minnesota outside this metro area is totally different than what happens down here. In law enforcement, we fought for years to get training that actually works in our area. We finally were able to do that. In the fire departments, we worked very hard to change things so the training that was at the state schools and the state-funded schools wasn't metro-centric. Representative Backer, this amendment changes a metrocentric to what the area of the state needs. Every area is different. We might be one state, but we're different. What goes on in northwestern Minnesota is totally different than what happens in southeastern Minnesota. What happens in both of them is totally different than what happens in the metro area. In the metro area, in law enforcement, if you call for help, in 2 minutes you have 8 squad cars there. In greater Minnesota, it can take me a half hour just to get the one squad to a call, let alone backup. In greater Minnesota, we work together, EMS, fire, law enforcement, to help each other. Because we know there's extra challenges out there. But if we don't take consideration of the differences, we're going to make it worse for greater Minnesota. Representative Backer, thank you very much for this amendment. And members, I request a roll call.
A roll call has been requested. Seeing 15 hands, there will be a roll call. Further discussion to the amendment. To the author of the amendment, Representative Backer.
Yeah, thank you, Madam Chair. And members, if we look at the amendment, I appreciate Representative Huot's comments. I at no time have talked about the care of a patient. I would agree with Representative Huot. The care of individuals that I respond to at 2 o'clock in the morning compared to down in Apple Valley, that scope of care should be exactly the same. So my amendment doesn't do nothing about that. My amendment does comparison with the operation of an ambulance service. There is a different operation. When the pager goes off for Browns Valley, if I'm at the end of the district, I'm in that rig 24 miles. The one end of the district, the other end of the district is 20-ish miles. That is different than when I was down here doing ride-alongs in the metro. So there is a operational difference. Not talking about the scope, but operational. So members, this is why we don't want a St. Paul director focus on the operation. We need to have a local focus. So vote green. Thank you, members.
The clerk will take the roll. The chief clerk will call the names of the members voting remotely.
Carroll.
Carroll, no.
Carroll, no.
The clerk will close the roll. There being 59 yeas and 68 nays, the motion does not prevail and the amendment is not adopted. There's an amendment at the desk. The clerk will report the amendment.
Backer moves to amend House File Number 4738, the third engrossment as amended, and the amendment is coded A16.
I recognize the author of the amendment, the member from Traverse, Representative Backer.
Madam Speaker, first I would request a roll call.
Roll call has been requested. Seeing 15 hands, there will be a roll call.
This is a pretty straightforward amendment. I would ask that the author would accept this one. It says that at least one of the public members must reside outside of the metro counties on the board. And again, that makes sense considering the scope of the greater Minnesota ambulance that we have. So I would ask, it's really a simple one there, Representing Huot, in my opinion. We need more service providers on these boards, and one of the public members must reside outside the metro counties. Thank you.
I recognize the member from Dakota, Representative Huot.
Great amendment. I would like to see a green vote on this.
Would you still like a roll call, Representative Backer?
Not needed, Madam Speaker.
Thank you. All those in favor say aye. Any opposed say nay. The motion prevails and the amendment is adopted. There's an amendment at the desk. The clerk will report the amendment.
Backer moves to amend House Law Number 4738, the third engrossment as amended. The amendment is coded A9.
To the author of the amendment, Representative Backer.
Yeah, Madam Speaker, what this does is, in the structure of the new agency, it talks about one of the appointments would be the majority leader from the House, the Speaker of the House, and then the majority of the Senate. So what we're having is the appointment that the governor does is only from the majority. And I think that's not right. It becomes more political than it should. I know the author and I would agree, Representing Huot and I would agree, EMS should not be about politics because it's about life-saving care in several situations. So what my amendment does is it allows also the minority leader to appoint a member, both with the House and on the Senate. So we actually will have two legislators serving from each body. The Speaker gets to appoint one, then the minority leader on the House side, and then the majority leader, minority on the other body across the building there. So I would ask for your support, members. Thank you.
I recognize Representative Huot.
Thank you, Madam Speaker. And members, I am all for this because as members in this chamber, I know have served on the EMSRB in the past. It wasn't until my service on the EMSRB 6 years ago that we noticed that there was supposed to be a senator on the EMSRB who never came. And I found out the appointment was never done. And so I know that's making fun of the other body and stuff like that, but now we're gonna have at least two from each body, and I think this is great because this will get more of us involved in a much needed service, and we need to have our hands on. So good amendment, please vote green.
Further discussion on the amendment. To the author of the amendment, Representative Backer.
Vote green. Thank you.
All those in favor say aye. Any opposed say nay. The motion prevails and the amendment is adopted. There's an amendment at the desk. The clerk will report the amendment.
Backer moves to amend House Law Number 4738, the third engrossment as amended. The amendment is coded A17.
To the author of the amendment, Representative Backer.
Madam Speaker, members, I was, and I thank the Speaker for forming the EMS task force and asking me to serve on that task force. Chair Huot on the House side and other members, we've served on that task force. And I made every single meeting, starting in St. Paul, going to Mountain Iron, down over to Elbow Lake. Then, let's see, we went to Mankato, and then ended up in Winona. And one of the things that I kept hearing during all the meetings is retention, recruitment, and reimbursement. Now, I will not disagree. There are some areas that will have some response times that is not as strong as it could be. And I can assure you, as a provider, what's most important right now that we have to address, members, is folks like me. I'm not a spring chicken anymore. Just ask my wife. She'll tell you. I'm no spring chicken. Good, bad, or ugly. Okay? I've been doing this gig for 29 years, and those runs in the middle of the nights get harder and harder every single time. Just ask my wife. On the last run, the language that I used when it was in the middle of the night, okay? And that was right when we came back from St. Paul late, and so forth. And I say that in a humorous manner, but this is not something to laugh at. Representative Keel, when her husband had a situation in her district, she dialed 911. They were there for her. Last year when she had a hiccup, now she was in state capitol at the SOB, and I had a response time of 6 seconds. I was quick. That's Sprint Medic, by the way, just like Sprint EMT. But what I'm trying to do, we'll use Representative Murphy. On the day that he was sworn in, I received a call about 8 o'clock at night and says, Jeff, I think I need you to come and look at me. And of course, us providers want to be there, but the challenge that we're having in EMS is recruitment, retention, and reimbursement. And as an EMT, we have something that's simple called ABCs: airway, breathing, circulation. If you do not have an open airway, you're screwed, okay? Okay, that person can have a cut on his leg or a broken femur, and that does not matter. And if we don't have the trained EMTs like Browns Valley right now, myself and a person that looks like me, he doesn't look as good as I do, my twin brother does, we take 80% of the call time. And he's 2 minutes older than I am. And we're seeing this across over and over and over. And when we were out across the state of Minnesota, time after time after time after time, recruitment, reimbursement, retention. Now, what helps with that? Funding. EMS have not received the funding that it should have for 30 years, okay? Us volunteers have been subsidizing EMS. And I know Representative Huot in committee has talked about, used me as an example. You know, if I don't remember the number, I think you said every run because of our low, it's like $9,800 I should be paid. That's a little high. I don't know if I'm worth that much. But on a serious note, we need full-time EMTs. I really like this, the hybrid system that's used down in southeastern Minnesota. They do a very good job having a full-time EMT or paramedic backed by volunteers like myself. So this addresses recruitment, reimbursement, and retention. This is what people are needing. And yes, we can provide this. And without the funding, we're just growing government, folks. We're growing government, and I have members say, well, if you just add an agency without the funding, does that mean you still have to take call every Friday night when you get back, and Saturday night, and Sunday until I leave for St. Paul? The answer is yes. Vote yes on this, members, and I do request a roll call.
Roll call has been requested. Seeing 15 hands, there will be a roll call. I recognize the member from Dakota, Representative Huot.
Thank you, Representative Backer. And yes, that was a portion of what we heard when we were on the road. However, the $122.5 million you're asking for in this amendment is nowhere else in this bill. I need members to realize that this is not the EMS funding vehicle. This is to put the guardrails in place. That's what this agency will be doing. For the last 3 weeks, I have heard about abuse, waste, and fraud. Go ahead and Google American Ambulance Association. See how many fraud cases come up. What I'm making sure is that none of us are embarrassed by what we're spending on EMS this year. This is the guardrails. This is what we have to do. This also answers response. What is our job as public servants? I get it. Jeff Backer wants to make $9,800 a run, which is kind of a joke, and he knows that's what I was saying. It's basically what we'd have to charge for his area to balance the bill. The program, the problem with EMS and the problem with the current EMSRB is they cannot get innovative. We think inside the box in EMS. And that's the biggest problem. We have not explored other avenues. Representative Johnson You're right. I was part of that team that worked to get the MSRB in place. It's time to move on. Looking around the country, we see different changes, but we are like every other state. We are having trouble, the same troubles that every state is having. We can't continue business the way it is. Just throwing money at a wall is not going to work. We need to make sure that money is going to do something, and I know both sides have those values. I know that we just don't want to throw something at the wall and hope that, well, maybe they'll do this, maybe they won't do this. When we asked the stakeholders, what is the 120 million? Tell me how you got to that number. You can ask 10 different people in the stakeholder group and you will get 10 different answers. So we're going to have more discussions about this, but I do have to say, please vote no on this. We don't have 122 million in this bill. That funding will come down the line. It's being negotiated now. I am hoping that it's that much, but I don't know. I'm not part of that discussion. I am a part of building the fence to make sure that we don't have people taking this money and doing the wrong things with it. This is my industry. I know it all too well. So please, members, pass on this one, and we'll have more discussions on other. Please vote no.
I recognize the member from Chisago, Representative New Brindley.
Thank you, Madam Speaker. This is an extraordinary, frustrating conversation. Representative Backer, I appreciate your efforts. I know that our EMS could use the 122 million. I get that. But as Representative Huot says, we don't have 122 billion in this bill. We actually don't have 122 billion at all. It doesn't exist. $122 million does not exist because we're spending it on a palace for politicians next door. There is no money. There is no money. So we talk about 122 million. It's not in this bill. It's not anywhere. It doesn't exist. Madam Speaker, I would move to rule this amendment out of order under Rule 4.03. This isn't just not out of balance in this bill. It's not out of balance for our state. We don't have $122 million to spend. And I would I would move to rule it out of order. Madam Speaker, advice?
Representative Brindley, when you stood to make this statement, you did not ask for a formal an out of order, a point of order. And so I just want to make sure I clarify that you are standing up for a point of order and you are asking for me to rule that this amendment is out of order. Is that correct?
Thank you, Madam Speaker. Yes, I rose to be recognized, but I would like to raise a point of order. Not only is this amendment out of order from the budget resolution that gives $16 million to EMS, there is $122 million does not exist. Like, it's absurd.
Advice. Representative Huot.
I didn't want to go here, but Madam Speaker, I'll take it if the House wants to vote for this. I'm in favor of it. Thank you.
Further advice. Representative New Brindley.
Thank you, Madam Speaker. Yes, my advice is that it's clearly out of order. There's $16 million in the budget resolution, and this bill calls for $122 million. It's absurd. And as much as I would like there to be $122 million, there's not. Not only is there not $122 million in the budget resolution, there's not $122 million, period. This is clearly out of order.
Madam Speaker, advice?
Representative Johnson, I've actually received the advice that I need. I'm ready to rule on this. Pursuant to Rule 3.21, I'm going to... Pursuant to Rule 4.3, I'm going to submit the question to the body. So the question before the body is it the judgment of the body that the point of order is well taken? A green vote means that the amendment is out of order and would be withdrawn, and a red vote means that it is. Make sure I say this. So a green vote means that the point of order is well taken and the amendment is out of order, and the red vote means that the point of order is not well taken. That is the question before the body.
Madam Speaker.
Representative New Brindley.
Advice to the body. Listen, I love you. I'm with you. I wish we would prioritize essential services. Wouldn't that be great? That would be amazing if that's what we did. But I hope we can have a little consistency. The budget resolution is for $16 million. This amendment is calling for $122 million. Like, come on. This is silliness. Both sides. My members, I hope you vote green. I hope you vote green and acknowledge that sometimes there's some things that we shouldn't do either. Because this amendment is out of order. It doesn't just bust the resolution that has 16 million in it, it busts the entire budget. It would be great if we had the money, but we don't. Like, this is so clearly out of order. The fact that we are even having this discussion is silliness. Vote green.
Further advice, Representative Johnson.
Madam Speaker, members, I believe it was last week, amendments were called out of order because there's $50,000 of money being used. As Representative New Brindley stated, the entire budget resolution is $16 million. This amendment has over $120 million on it. As much as I would like to have this taken care of, our Constitution puts public safety as one of the priority things that the state is supposed to do. But unfortunately, the budget resolution doesn't think so. So members, vote green.
I recognize the member from Stearns, Representative Demuth.
Thank you, Madam Speaker. Would Representative Olson yield for a question?
She will yield. Representative Demuth.
Thank you, Madam Speaker. Representative Olson, or Chair Olson, could you just clarify before we make this decision if the budget resolution has, what the budget resolution is? Would it have $122 or $120 million for EMS services?
Representative Olson.
Thank you, Madam Speaker. So the budget resolution has the general fund spending, HCAF, excuse me, and workforce development funds. We have an other bills category, and so we do have some, I would need to look at this more closely to know what we have on the bottom line for available spending as it relates to this amendment, but I guess that's the answer I give for now.
Representative Demuth.
Thank you, Madam Speaker. Thank you, Chair Olson, for that information. Members, before I continue, Madam Speaker, could I request a roll call?
A roll call has been requested. Are there 15 hands? Seeing 15 hands, there will be a roll call.
Thank you, Madam Speaker. You know, as we look at something as important as EMS for our entire state, and the shortfall, the deficit that is being faced by this, not just in one area of our state, but all the way across the state, we are hearing that there is need for recruitment and retention and help in an area that they are asking for our help. We have also seen earlier with an amendment the desire on the majority's part not to separate greater Minnesota and rural Minnesota and the metro area. We are talking about something that would affect all of us. We all travel across the state. We all are very dependent on, when we make that phone call, having first responders, having emergency services when we need them. And I have to think back to the fact that we fund and budget and pay for what our priorities are. If we can't even see the need in EMS and fund the greatest need across the state at only $120 million, we are doing the wrong thing in this body. There was $18 billion of surplus. That would have just been almost next to nothing compared to that we could have funded this. But instead, all of that is gone. And we are here in the final days of session saying, I'm sorry, this is a need across the state, but we can't fund it right now because we're out of money. That is absolute misplaced priorities. Unfortunately, though, at this point in time, I am going to ask members to vote green. This is out of order. But it's not out of order because it's not a necessity. It is out of order because the majority has decided this isn't important. Members, vote green.
Members, just to make sure that we are all clear on what we're voting for pursuant to Rule 4.03, I have put this the motion to the question to the body, and so it is the judgment of the body. What you are voting on is that the judgment of the body, the point of order is well taken. A green vote means that the point of order is well taken and the Backer amendment is out of order. A red vote means that the point of order is not well taken. Representative New Brindley.
Thank you, Madam Speaker. Members, I hope that we're paying attention to what we're doing here. Because if this is found to be in order, you have an obligation to find $122 million for our EMS, because clearly that money exists. If this is in order, you are telling us that there is $122 million, and I can't wait to see where you find it. I sure hope you take it out of the palace for politicians. I can think of all kinds of places that we could have taken this money from, but for sure we can find a cheaper fix to a leaky roof. So if you vote no on this resolution right now, or on this motion right now, this point of order, if you vote no, I hope you're prepared to find $122 million, because apparently it exists. It's not in the budget resolution, but apparently it exists. So I sure hope you vote yes.
The clerk will take the roll. The chief clerk will call the names of the members voting remotely.
Carroll.
Carroll, aye.
Carroll, aye.
Have all the members who wish to vote voted? The clerk will close the roll. There being 125 yeas and 0 nays, it is the judgment of the House that the point of order is well taken. There's an amendment at the desk. The clerk will report the amendment.
Backer moves to amend House Law number 4738, the third engrossment as amended. The amendment is coded A15.
To the author of the amendment, Representative Backer.
Yeah, Madam Speaker and members, this bill this amendment starts to do what we've heard out in the field, fund EMTs instead of FTEs. That's what we start to do here. What we're doing in this amendment is we're taking $3 million from the $6 million of the Sprint program and putting in what I refer to as non-transport runs. Members, doesn't matter if you're in the metro area, suburban area, or greater Minnesota.
Good God.
Today, statewide, we had 1,000, we're going to have 1,660 calls, 911 calls for assistance. 20% of those calls will end up as a non-transport. That can be a lift assistance. That could be a refusal of care, or it could be very serious, in which a helicopter comes and lands on the scene and the person doesn't transport it. I was talking to the county commissioner before Grant County, earlier today from Grant County, because they do run a Sprint Medic pickup already. And I mentioned it to him, and he goes, you know what, Representative Backer, this makes sense, because one of the challenges that we are having, again, is reimbursement, retention, and recruitment. And one of the reasons that we are having this problem is because roughly 70 to 80% of the runs, especially in greater Minnesota, is going to be reimbursed through Medicaid and Medicare. And you do not have to sit on a health or human service committee to know that we are not paid more than probably at best 30 cents on a dollar. That's if we load them. But if we don't load them, like Representative Huot has said, and he says this quite well, if the wheels don't turn, we don't get reimbursed. So what does that mean? That means your ambulance services in your neck of the woods, doesn't matter if it's a hospital-driven system, a fire, a volunteer, a city or a county, that means we're pulling resources from other places. And this formula, it really needs more than $3 million, but right now, we can't get $120 million, obviously, but we can take some of it. This is the real issue. Again, remember I talked about earlier ABCs, airway, breathing, circulation? I'm not saying a Sprint model is a bad program. What I'm saying is that's kind of like a broken femur. Right now, we have so many services that are needing to survive. They need their airway open. And this helps out with those non-transport runs. So members, I would ask for a roll call. Amen. Madam Speaker, I ask for a roll call. So,
A roll call has been requested. Seeing 15 hands, there will be a roll call.
I was asked Green for this amendment. Thank you.
I recognize Representative Huot.
Thank you, Representative Backer. And the problem with this amendment is, who do we cut? Who do we cut? Do we cut Representative Murphy? Do we cut Representative Scarba? Who gets cut? Because that's where the $6 million is going, to two of your areas. In the unreimbursed account, it's a good idea, and Mississippi just did it. But they did it by telling their payers, the private payers, that they have to pay for this. They didn't make the government payers pay for it. So this has to be worked out. And the problem here is, what rate do you pay this at? Do you pay it at the Medicaid rate? Do you pay it at the payer rate? There's all sorts of problems with this. I'm not saying we don't need to do something like this in the future, but let's face it, folks, the Sprint Medic model is about response. I can tell you what I'm going to expect from emergency services when I pick up the phone and say, my wife is on the ground. My wife is on the ground, please get here. And that time starts, and they got to get there, because when Jeff Backer runs through the door, I know that my wife is going to get the care she needs. That is so important to me, that we get somebody to the scene. The Sprint Medic model will do that. It's tried and true. As Representative Backer said, his county's already using it. I believe there's other places using it too. This is the new modeling for EMS. Why aren't we here already? But we need to get some study done on this. We need to take this idea to Washington so we can get reimbursed on it, so we can start an uncompensated pool. These are all things, and I'm all for if we do get more money. There's, like I said, there's about 10 million hanging out there that's in the budget resolution that maybe that can come out of this, but this model, if this bill passes, is too important. That we need to keep those so Representative Murphy's area, Representative Scarborough's area can get the fast response they need. Please vote no on the amendment.
Further discussion. The member from Chisago, Representative New Brindley.
Thank you, Madam Speaker. Boy, it's frustrating. When we set up a bill that funds 3 counties, when there is a statewide need, and then we say, well, who are we going to cut? Well, as it turns out, no one's getting cut yet because no one is being funded. But to suggest that we're going to take these little meager dollars, this pittance that we've set aside for EMS, and give it to 3 counties as though that is somehow going to solve the problem? Come on. Thank you, Representative Backer, for recognizing the need is far greater than for 3 counties. You look at the need across particularly rural Minnesota, but it applies everywhere. And we're going to use this pittance to take care of 3 little counties. That's what we're going to do. It's just wrong. That's not the right way to do this. The right way to do this is to find actual solutions. And frankly, I don't think we're doing that by funding FTEs instead of EMTs, like this underlying bill does. I don't think we're going to solve our EMS problem by creating bureaucracy instead of funding EMTs. That's what we need to do. Sometimes people around here, sometimes people in this building like to play chess when you could just play checkers. Sometimes it is not nearly as complicated as we try to make it. But that's what we're doing in this bill. We're building bureaucracy. This bill is building bureaucracy. It's funding FTEs instead of EMTs. The need goes far beyond 3 counties. It just does. And so to think that we put this together, that we put this bill together to take care of just 3 of our rural counties? Minnesota is a state with 87 counties. 87 counties. There are 5, 7, 11 metro counties, depending on how it's defined for whatever programs. But with this bill, we're just going to take care of 3 of them. We're just going to take care of 3 of them. That's enough. And instead, we're going to take care of 3 of them. And while we take care of 3 of them, we're going to create some bureaucracy because that'll help the rest of the problem. We're going to hire more FTEs at the state because that will help solve the problem. No, we don't need to play chess here. We don't need to game this out. Steps down the road. Sometimes we just play checkers. How did you say it, Representative Backer? Retention, recruitment, reimbursement. That's it. Retention, recruitment, reimbursement. That's what we need. But you know who needs reimbursement? All of our counties. Not 3 of our counties, all of our counties. And so why are we picking winners and losers? Because that's what the bill is doing. We're picking winners and losers. We're saying, hey, St. Louis, Grant, Otter Tail, you guys can have some money. But our other 84 counties, you're just going to have to wait and see what we can do for you. You're just going to have to wait. We got to game this out a little bit more. We got to hire more FTEs. We need to have some more bureaucracy to talk about things so we can figure out how we really want to handle this. And then we'll see what we can do. And then we'll see what we can do. We just heard there's a disproportionate impact. We need to get another study done. We need another study. More FTEs, more bureaucracy, more studies. I bet we could throw in a task force too. I bet we could pull some money out of the $16 million for a task force. I bet we could do that. Then for sure we could solve our problem. For sure we could figure it out. I bet we could do that. How about we just play checkers? How about we just acknowledge that our EMS services need reimbursement? And if they have reimbursement, they will have recruitment and retention. If they have reimbursement, that'll go an awful long way to help solve this. But instead, we're going to pick winners and losers. We're going to choose just 3 counties to help, and everyone else will be on their own. This was the problem with the bill yesterday, right? Creating new offices, new studies, new task forces, all of it. These are the things that you do when you have money in a state budget to spend. These are the things that you do when you have a $30 billion, well, existing and manufactured surplus, because we increased taxes by $10 billion. These are the kinds of things you do when you have money. When you don't have money, you take those few pennies you have and put them where you know the need exists. And it's not just 3 counties. It's across the board. Thank you, Representative Backer, for the amendment. I will be voting yes.
I recognize the member from Moller, Representative Mueller.
Thank you, Madam Speaker and members. And Representative Huot, you asked the question, where do we cut? Well, I'll tell you, in my district, everything is being cut because they're closing. Because they're closing. I went to a meeting not too long ago at one of my ambulance services, and they begged, they were begging me and their constituents for how we could get more money for them, because as you are hearing from Representative Backer, that when they go on these calls that are non-compensated, they're still using resources. They're still using not only people, but they also have supplies that they're using and all of those things. Recruitment. I'm sorry, if I have to listen to another thing of how we're going to create a bureaucracy because somehow that's going to create innovation, I might have to call on someone and say, check Minnesota Department of Education. Because how many times have we heard about innovation, and yet our classrooms are trying to do that, and MDE is the one that's stifling them. So yes, let's go ahead and create a brand new bureaucracy that's somehow going to foster innovation, even though it's never been able to do it in the past. It's never been able to do in the past, so let's go right ahead and try it again. I know of, we're talking about retention. We have heard from people where they want to actually do EMS classes that will count for credit equivalencies in other places. MDE has said no. That might help a little bit of our EMS and our EMTs. Are you kidding me? We are going to vote no on this amendment because we are too busy trying to figure out how we're going to hold other type of funding hostage just so that we can create a whole new bureaucratic system that somehow is going to foster innovation. While my area EMTs are dying, and they can't afford to wait for this bureaucratic system to somehow create innovation for them. Please vote green.
Further discussion to the amendment. To the author of the amendment, Representative Backer.
Yes, Madam Speaker and members, one thing that was sitting on the House floor is that we need to get someone to the scene, and that is 100% correct. When someone dials 911 and when it is a true emergency, we need to get them to the scene. And one of the challenges is, as we have heard from other members, is the lack of resources. And every service in the state of Minnesota has this challenge. Members, I will pull this amendment because it does solve a solution, but I hope that we can work on this in the conference committee. I will fight for this really hard, but at this time, I'm going to pull this amendment. Thank you, Madam
Representative
Speaker.
Backer withdraws the amendment. There's an amendment at the desk. The clerk will report the amendment.
Backer moves to amend House Law Number 4738, the third engrossment as amended. The amendment is coded A13.
I recognize the author of the amendment, Representative Backer.
Yeah, Madam Speaker, I'm going to ask for a roll call on this one.
A roll call has been requested. Seeing 15 hands, there will be a roll call. Representative Backer.
As Representative Huot and I have talked quite frequently over the last 3 weeks, one of the biggest challenges I have with this agency is the tremendous amount of rulemaking that it has. And I respect Representative Huot. He's going to say if you don't have rulemaking, you can't get things done. Pretty much so. He might say it a different way, but that's how he's going to summarize it. And the challenge, when we were looking through the rulemaking, when this bill was created, if you look under Minnesota statute 14.389, 14.389 on the expedited process, subsection 5 was left out in this bill. And that is authorize basically a public hearing, because if you look at the expedited procedures, you got to have an application, notice and comment, adoption, legal review, and basically a public review process. If 50 or more people submit the written request for a public hearing, the agency may adopt the rule only after complying with all the requirements of Chapter 14. So if we're going to expedite the rulemaking, yes, EMS is important, but EMS needs to follow. If we're going to go this route for rulemaking, let's follow all the rules. Let's not give a bureaucrat in St. Paul more authority than this has already. We need a little balance. We really need a whole lot of balance. So that's what the reason for this amendment. Thank you, Madam Speaker.
I recognize the member from Dakota, Representative Huot.
Thank you, Representative Backer, and I'm going to ask for a no vote on this simply because the agency needs the authority to make rules. The OLA report was very clear on this, that one of the things the MSRB continuously failed at is rulemaking, holding services accountable, holding themselves accountable. So basically, we do not want a repeat of those terrible audits that happened. Basically, here we go. I'm going to go again. Abuse, waste, and fraud. I changed the order. And so that's what this is about. This is about putting the guardrails up. Rulemaking is part of that. This agency needs to do it. Representative Backer really feels, I think, that we can do it as a body. We can't do it. We don't have enough experts in here to be able to make rules for EMS. We trust our agencies to do this work. This board did not do its work. We need to rein in this in. The OLA audit was very clear on this. This is one area that I just need to see, so please vote no to the amendment.
I recognize the member from Olmsted, Representative Quam.
Thank you, Madam Speaker. And anyone that looked at, attended, or has listened to the meeting, the committee hearing on this, would realize why we want a community hearing on the rulemaking, because testifier after testifier, in fact, it was filled with testifiers that had issues with this change in approach to replacing the EMSRB. The room was filled with people that wanted to be heard and have their voice heard, and saying we don't need a public hearing is disappointing, because we had voices from across the state different perspectives, different communities that came forward to speak. That is how you ensure any rules, any changes are actually the best, not deciding you've got a small group you formed, although this isn't quite a small group that's on here, but it's not diverse enough, I think, to avoid mistakes or things that won't work in parts of the state. That's why we have public hearings, to actually allow people from across the state to come and speak. And hopefully this time, if we pass this amendment, they'll actually listen to the testimony about the issues. Vote green.
I recognize the member from Isanti, Representative Johnson.
Madam Speaker, members, Representative Backer, thank you for a great amendment. This body has always requested and appreciates public input. The rulemaking should also have public input. Without it, we don't know what's going. The public, we do not want to shut the public out, especially in this body. This is the people's house. The key word is the people. The people is the citizens of this state. It's unfortunate, as Representative Huot said, the current board's not doing their duties. All 16 people appointed by the governor have failed to do their job to make sure our EMS system is working properly. And again, they're all appointed by the governor. But rulemaking is, I've seen going on for the last number of years while I've been down here. And I've seen the value of going to those meetings when they have the public input, listening to what the public says. So when these rules go into effect, that is what is best. Now, these board members that are doing this, let's see, there's, in the bill, there's, we added 2, so now we have 18 on the ambulance, 11 on the physicians, and another 6 on the labor. Three new committees making rules. And again, I'll check with that later. But without the public input at that hearing, that's where they can find more information to make sure the rules are right, and it's going to be the best for all citizens of this state. Vote for this amendment.
I recognize the member from Chisago, Representative New Brindley.
Thank you, Madam Speaker. So the law regarding expedited rulemaking is written a little strange. And I always think, folks, probably, if you haven't dealt with this at all, or if you're new here, you probably have not looked at this before. And so I think it's important that everybody be very clear about what this amendment does and does not do. This amendment does not change decision-making authority. This amendment does not take away rulemaking authority from the new office. This amendment does not require legislative oversight. It doesn't do any of those things. The only thing this amendment does is ensure that if 50 people request a public hearing on the rulemaking, then you got to hold a public hearing. And I can imagine, given how much each of us in this chamber have heard about this issue, I can only imagine that there could be 50 people across the state who would at least want to have input on what's going on. They don't get to change it. They don't get to modify it. It's just a public hearing. And frankly, it has nothing to do with the legislature. So the way, and in fact, I would direct everyone, if you want to pull it up, it's, in the amendment, after statute 14.389, this is what subdivision 5 says, a law authorizing or requiring rules to be adopted under this section may refer specifically to subdivision 5, may refer specifically to this subdivision. If we do not specifically refer to subdivision 5 in this bill, then the people of Minnesota do not have an explicit right to a public hearing. But by including subdivision 5, and again, this underlying statute is wonky. We should get rid of this entirely, and it should just be that if 50 people request a public hearing, we should have an obligation to do it. I mean, the way this underlying statute is written really is wonky. But if the law contains a specific reference to this subdivision, subdivision 5, as opposed to a general reference to the section, so just referring to 14.389 is not enough. You specifically have to say, including subdivision 5, so that the people of Minnesota can ask for a public hearing. It does not involve the legislature. It does not give the legislature any authority over the rulemaking. It does not give the public any authority over the rulemaking. It does none of that. So what we were just told is not accurate. The only thing that happens by including subdivision 5 is that the people of Minnesota can request a public hearing. That is the only change that is being made with this subdivision. And I would encourage members to vote yes. In fact, Madam Speaker, do we have a roll call on this amendment?
Representative Brindley, there is a roll call.
Excellent. We should absolutely vote green on this.
Further discussion. The member from Hennepin, Representative Robbins.
Thank you, Madam Speaker. I rise in support of this amendment. As members might recall from last night, we had a big floor fight on the lack of a public hearing through the whole process of creating that $730 million palace for politicians across the street. This is the least we can do to ensure that the public is brought into this process and the public can request a hearing if they want. Members, we have to do more to make sure the public is aware of what's going on around here, and this is a really good amendment. Vote green.
Further discussion. To the author of the amendment, Representative Backer.
Yeah, let's talk. Thank you. Just a couple things here. You know, one of the things that I heard is that we're going to trust agencies. You know, as Ronald Reagan said, if government comes to your doors here to help, you better run. Agencies have had waste and they have had abuse. That's been proven. One of the things the OLA has, in their report, never mentioned anything with fraud or abuse in the board. Let me summarize some of the things that the board did, that the audit did summarize. And I looked at this summary. I did not say that anything about rulemaking. It says the legislature should adopt more stringent statutory requirements. Again, statutory requirements, not rulemaking from a director. It also said develop and enforce performance standards, options for improving ambulance service sustainability, should improve its oversight of the executive director, and then structural changes, didn't say a whole new agency, structural changes to the EMSRB board. So if we do not have, if the public, when you vote red on this, you are voting to do the same thing that we have saw across the street with the Palace for Politicians. And that's so true because there is no public oversight. It's kind of like going door knocking at night. People just don't see you, and so forth, dressed up in black. I mean, seriously, we have to have oversight over this because absolute power corrupts absolutely. Vote green for this amendment. Thank you, members.
The clerk will take the roll.
1.
The chief clerk will take the
Call it.
the chief clerk will call the names of the members voting remotely.
Carol.
Carol, no.
Carol, no.
The clerk will close the roll. There being 60 yeas and 68 nays, the motion does not prevail and the amendment is not adopted. There's an amendment at the desk. The clerk will report the amendment.
Backer moves to amend House Law Number 4738, the third engrossment as amended. The amendment is coded A19.
To the author of the amendment, Representative Backer.
Well, members, this is the last amendment, so I was hoping that last one would have a little light. I would suspect this one may even have a more of an uphill battle, but this goes again with the rules. Nothing in the audit's summary talks about rulemaking, but what this amendment does with all the rules that is in this new agency, it basically gives a check and balance. Everybody understands in our civil classes in social studies, we have 3 branches of government for checks and balances. And what this amendment does, and it allows rulemaking to be approved by us. Ooh, I think we're elected by the people, elect us to be their voice instead of a director in St. Paul. So members, again, this allows public input through us, and that's much more effective because the likelihood of us whenever you're in the minority, and it will switch, and when you're in the minority and the governor is in the majority party, likelihood of getting the governor's attention to talk about a EMS issue is unlikely. And so from a constituent perspective, so a constituent, they're going to come to us, we're going to respond to them. So this again gives checks and balances in a system on an agency that is too one-handed, the structure of it. It really, it's just a common sense amendment. Vote green, and I do request a roll call.
A roll call has been requested. Are there 15 hands? Seeing 15 hands, there will be a roll call.
Thank you.
I recognize the member from Dakota, Representative Huot.
Thank you, Madam Speaker. And Representative Brindley, thank you for being gracious to me. This was the one I wanted to talk about. Not the one you had, but I would have voted the same way. Representative Backer, I'm kind of intrigued with this. I know that other states actually do pull the authority in their houses to pull back rulemaking. And I think this is something maybe we should put to the membership on all rules. But on this one, because we're not doing it anywhere else, I think this would definitely put this new agency not in a good space. So I'm asking members to vote down. Thank you.
Discussion on the amendment. The member from Isanti, Representative Johnson.
Madam Speaker, Representative Huot, thank you for admitting that we should be taking control over the rules. I appreciate that. In fact, I had an amendment yesterday that did that, but unfortunately that was shot down. There's a lot of other states do it as well. But this isn't important. This is dealing with lives of the citizens of Minnesota. Our ambulance crews are stretched to the limits. And unfortunately, the current board's not doing their job. The current board's all appointed by the governor. And they haven't been doing their duties. But with this amendment, it gives us a chance to double check the rules, make sure they're right. Right now, I don't know if you know it, but the current current procedure is both bodies have to say no, not yes. We shouldn't have to say no. We should be saying yes on the rules. And this is an opportunity to do that. Thank you, Representative Backer. Please support the amendment.
Further discussion? There being no further discussion, the clerk will take the roll. The chief clerk will call the names of the members voting remotely.
Carol.
Carol, no.
Carol, no.
Have all the members who wish to vote voted? The clerk will close the roll. There being 59 yeas and 69 nays, the motion does not prevail and the amendment is not adopted. There are no further amendments at the desk. The clerk will give the bill its third reading.
Third reading, House File Number 4738, as amended.
Third reading. I recognize the member from Hennepin, Representative Nadeau.
Thank you, Madam Speaker. Members, thank you, Representative Huot, for working so hard on this bill, and Representative Backer for always reminding us of a lot of the basics that a lot of us miss. You know, I've been waiting to support this bill, Representative Huot, and I know that you've moved it a lot. And you never made that big jump that all of the EMS directors were always talking about, is that the director, and I think most people can get around the idea of changing, the bureaucracy a little bit. But what we never got around to is this bill is full of regulation. It alludes to some innovation that's not in the bill, and where it falls woefully short is that it doesn't address the problem. And the problem is funding. And I remember when we sat in committee, and I don't remember if it was the chair or if it was you or if it was someone else, and someone correct me, but they said that this bill wasn't going to move forward with all this regulation if it didn't have the funding. And this bill doesn't have the funding. It doesn't provide that relief that we need. We've got a pretty big idea that's going to create a number of advisory bodies that encapsulate the community. It's got an appointed executive director that's not even a physician. It could be. It might be. Maybe it's a physician. But it's not in the language. It's not a physician in the language. And that's where we have these problems. I love the idea of trying to have the sprint pilot, looking at innovative ideas that might work out there. But early on in your comments in the introduction, you talked about regardless of zip code, or I don't think you used that, but regardless of where one lives, if it's the best ambulance service in Representative Nash's district, which I would submit that I think mine's better, but that's just me. I'm a little parochial. Or if it's Representative Backer's district or any other district, one size doesn't fit all in Minnesota, especially with emergency management. And as you know, sitting on the Health Committee, the struggle that we have with reimbursement and payments, we spend so much time pretending to do something when what we need to do is focus on we're payers. We pay. That's what we do. That's what we need to do. And when we spend all the money someplace else, and then we come back and we say, well, there's not enough money. There's not enough money to do those things that we really intentionally need to do. So Representative Huot, I appreciate the work that you did on this. I appreciate the people that you listened to. Representative Backer, thank you for always, standing in that thing and stepping up and trying to participate. But this bill it doesn't do enough good to justify changing the system. Members, please vote red.
I recognize the member from Carver, Representative Nash.
Thank you, Madam Speaker. And first, before we even jump into this, it hasn't been said, but to those that are EMSs, thank you. I just want to make sure that you know that we are grateful for the service that you do that really is undervalued, but so very, very important. And if you've ever had a loved one that gets transported, or if you've been transported, I may have done that myself, it's important stuff. But I want to stand in opposition to the bill, and Representative Huot knows why, and we've talked about it. And you referenced my district's ambulance service, Ridgeview Medical Center. Ridgeview is the largest employer in Carver County, and they do an amazing job. I had the privilege of serving on their hospital board, and the hospital runs the ambulance service, and they are different than a lot of others. They get it right. And what they do is they have rigs on the road at all times, and not only are they in an available status to go to a call, but they are also doing follow-up on post-op surgery or post-visits to the hospital, so that if person A had been in the hospital, let's say 3-4 days ago, they've been discharged, they will actually stop by and make sure that you don't have questions with your meds, which is a very frequent thing, that people will be confused. They get sent home with 5 or 6 bottles of pills, and they have to take them, and they forget. And if in missing the periodicity that they have to have on taking those meds, oftentimes they wind up back in the hospital. And I'm sure, Representative Huot, you've had to go to someone's house and transport them back because they weren't doing that due diligence. That's the magic of Ridgeview, and they do it exceptionally well, and I think they are a model for the state of Minnesota. And if this bill becomes law, and I did speak with the CEO, and they are opposed to the bill, as is the Minnesota Ambulance Association. You all have that letter, I think that Representative Backer had that sent out. So there are 3 of our members here that represent Carver County. Representative Harder is off doing something. Representative Ream, myself, I think we've all had meetings with the CEO and the team at Ridgeview. I encourage you to consider voting no on this bill. I urge you to vote no on this bill because it would adversely impact how Ridgeview does what it does. And would the author of the underlying bill yield to a question?
He will yield. Representative Nash.
Thank you, Madam Speaker. Representative Huot, you and I had said in committee and talked that this would negatively impact the way Ridgeview does things because with the creation of the greater bureaucracy, they may change the paradigm in which they operate. And I just wanted to make sure that I had gotten that answer correctly.
Representative Huot.
Thank you, Representative Nash. And this has been my dream the whole year to get a question from you. It's kept me up at night. So, Representative Nash, I think this is fear of the unknown that you're talking about. Waconia, Ridgeview, I've known them since I've been in EMS. We recruited many of the medics out of there to do flight operations. You're right, you have a stellar operation. It's a model operation. And I would expect the state to look at that operation and model others after it. That is not what this bill is about. This is not about going to regulate everybody. This is about giving our regulators, smart regulators, the right. And somebody talked earlier about not having a doctor. There is a position for a physician. They came to us. We changed the bill. And you're right, Representative Nash, in here, the Ambulance Association, who was for the bill, well, they're neutral on the bill. Last night they flipped on the bill because without money, they don't want the bill. So they all put the, which totally is something I'll bring up in my closing, but the point of the matter is, Representative Nash, no, this should only enhance Ridgeview. And I'm looking forward to watching Ridgeview grow with this, because you're right, you're doing the community paramedicine model. They have a system status, that's what you're talking about in our words. And so I think it's going to be great to see how much it grows out there and how people come to Ridgeview as a model community. Thank you.
Representative Nash.
Thank you, Madam Speaker. Well, Representative Huot, if I would have known that you wanted to yield a question, I would have gotten to that way earlier. I apologize for my negligence. Again, speaking to the CEO and knowing, as I served on the board for 4 years, and that was something that was talked about regularly, is the magic of that model. And the creation of a czar or a centralized bureaucracy, that never goes well. I mean, can we all agree on that? Centralized decision-making in the hands of a handful of people, with one person in particular being the Grand Poobah or the czar over all those things, rarely, if ever, works well. And that is the concern of both the Ambulance Association and Ridgeview. And once again, I encourage Carver County delegation members, Representative Ream, Representative Harder, the largest employer of the district, the largest employer of the county, is opposed to this bill because it's going to adversely impact how they do business. It's going to adversely impact the success that they bring. And Representative Huot has talked about how impressive and beneficial and good a model it is. In passing this bill, it's going to hinder the work that they do. And it's not just Carver County. They have multiple areas that they are servicing, because they own hospitals in Arlington. They have a place in Le Sueur. They are on the road, and they go to larger catchment areas, so you'll see them in Hennepin County if necessary. You'll see them beyond just the traditional boundaries of Carver County. Why? Why would we make a choice to vote for a bill that would negatively impact a very successful, author agreed, they are a very successful organization. They are a model organization. And now we're going to water that down with centralized bureaucracy and a czar that's going to tell other folks how to do what Ridgeview already knows how to do. As a concerned legislator for Carver County, I cannot see how anybody could vote green on this bill, because it's going to negatively impact the fine care that Ridgeview delivers to the people who need it. Because when you're, I'm sure, and I won't ask Representative Huot to yield, but when you're in the back of an ambulance, you're having a bad day. Why would we make it so that the people who are having a bad day, that need help, to be transported quickly, won't get that? And a quick personal anecdote. When she was about 1.5, my daughter, Emily, who is now 16, got into a toxic substance. We called the poison control, and we called 911. And because of the model that Ridgeview had, they were there in a moment's notice, got my daughter transported to Children's, because they knew that they didn't have everything that was needed at the Waconia campus. Without their model of ambulance service, and if it goes away or gets changed or adversely impacted, that would not have been a success story. So my family has lived that. My family has seen that. And Representative Huot knows how much I cherish my kids. I was overwhelmed with the speed at which they deployed their service. My daughter was at Children's in a moment's notice. They did a great job. This is going to hurt that. This is going to make it so that another family may not have the same results that mine did. So I urge you, members, vote no on this. I know that there are problems with other ambulance efforts. I'm sure Ridgeview would be happy to help. I know the CEO. You and I could go grab a beer with him, and he would help you out and share knowledge. But this is a bad bill. This is a bad bill. We should be voting no.
I recognize the member from St. Louis, Representative Celeste Nakar.
Thank you, Madam Speaker, and thank you, members. I want to thank Representative Huot and Representative Backer for the opportunity to serve, and Representative Liz Lagarde also, too, to serve on this EMS task force. I'm going to make a few different points today than probably will be said. And first and foremost, without caregivers, there is no care. Let me say that again. Without caregivers, there is no care. So, one of the things I've learned being a leader is there's a season for change. And I love innovation, and I love trying new things, and I understand what Representative Huot's trying to do, and I appreciate it. The sprint model isn't a bad model. From my perspective, it's just timing. And I think it's not the time for this change. And we spent a lot of time going around the state listening, and I think you have to listen, and then you have to learn, and then it comes back to this task force to lead. And I say that in all due respect. I think the sprint model has a very appropriate place. I know it's been tried in Mississippi. They have half the population of Minnesota in their size. And not that that is a relevancy 100%, but I do think that what is relevant is that it's only been 1 year since the national emergency declaration of the pandemic has ended, and we are in a healing process across the country coming out of this pandemic, and it really hit healthcare. And the EMS system is just like the other systems we were talking about this week that do 24-hour staffing and care. And so from my perspective, the time to make a system change is not when you're coming out of chaos. It's not when your team is broken down across the state of Minnesota. When I was initiating change, it was usually when we were in our stable moments as a company, as an organization, nonprofit, for-profit, or in government. I've worked in all three. But when we did major changes, we were in a stable mode. And stable meaning we had adequate staff, we were in an ability to lead in innovation, and it isn't fear that I'm operating on. I'm coming at it from a common sense operation level of what it takes to staff 24 hours, 365 days. And I really think that this is just a premature idea. It's a good idea. It's just the timing. We aren't in the season coming out of a pandemic to incorporate this. The other thing I want to talk about is the OLA, the most recent EMS ambulance service report that came out, I believe was 2022. And I've read that. And I believe there's under 600,000 calls. And the thing that I was really impressed with as a new first-time legislator is there are many OLA reports where there's been nothing done. I mean, we're talking about reports to the report, to the report, to the task, to the study, but we didn't do anything. What I was impressed by is this emergency board actually did implement a lot of the things that were said to fix and to change. And that was in 2022, so we're in 2024. And yes, there is a new director, but leadership often can come from the director, and yes, putting your eggs in one basket makes some people nervous that if that director leaves, then we're going to be right back to the same point. The point is that I think a lot was learned after that OLA report, and regardless of the director, those systems are going to stay in place. And there's been a lot of positive changes, and I know Representative Huot and I have talked about that, and there has been success. The other piece that concerns me is just, I heard over and over, recruitment, retention, and reimbursement. And those are three things that have been in the report back since 2002. and not one of those things are being dealt with in a position that's going to actually transform Minnesota. Because if you have reimbursement, if you have a way to do recruitment, which comes with how you're going to pay, it's going to lead to retention. And when you have those things, you're going to get a response time. Because it goes back to the first thing I said. Without the caregiver, there is no care. So we can create any fantastic board that we want with however many layers of division we want to have in it. And that is just going to do the same thing we've done in this entire biennium, is grow government by 40%. But that's in St. Paul. That's not going to change the outcome in greater Minnesota, rural Minnesota, or transform the care. And while I appreciate what's happening with the medic or the paramedic in the sprint model for the counties, I understand it. To me, it's just a timing issue. It's not the season. We are in a serious season of recovery. And when the people that are doing the jobs are saying this isn't what we want right now, we have an obligation to listen. Because when the people that do the job exit, not one of us in this chamber who are going to listen to reports are going to go do the job except two of them sitting here for as long as they do it. And that is where my concern comes. So I feel like at this moment when we're crawling out of a pandemic that has really hit healthcare harder than any other field, because you can't work remotely, we have to address the fundamental things of what is going to inspire somebody, and it has to come with some compensation that is meaningful, and it has to have local control to allow the divisions of how it's set up in their communities to meet the needs of their community best. So growing St. Paul is not what I came here for. It was to make sure we had services back in the community. And I think there's a season, and this is just not the season for this board. And I appreciate the efforts that Representative Huot has done and the experience of Representative Backer. But for those reasons, I will be voting no on this bill because we have to listen to the people. And I'm getting emails and texts constantly back from my townships and from the cities I represent in northern Minnesota. And they're very concerned on what this is going to look like. It's kind of like throw the baby out with the bathwater, and it's not a good situation. And I really don't think it's the time to do a significant structural change in 2024 until we have stability. And then we can do a new innovative program. I think it's about timing. I urge you to vote no. Thank you.
I recognize the member from Nicollet, Representative Brand.
Thank you very much, Madam Speaker. Members, I rise today because there's a couple of things that I think are really important to get in this conversation that maybe aren't being talked about in this particular time. I'm also on the EMS task force, and I have to say that we travel the entire state. I still have a lot of memories in my mind from our stop in Mountain Iron up in the Iron Range. And I tell you what, it might be working in some places, but I can guarantee you that the house is on fire, and the house has been on fire for 8 to 10 years in the state of Minnesota. And we haven't done anything in the state of Minnesota in 8 to 10 years, even though this crisis has been boiling over. I hear about places like Tower, where they're paying stipends to get people in ambulances, and they still are losing volunteers. They can't even staff 24/7 or 365 days a year in Tower, Minnesota. It's kind of a serious situation, because when you think about it, the city of Tower loses $103,000, at least they did in 2022, for the ambulance service that they do provide, even though they don't actually provide 365, 24/7 service. Also, it's really important to note that they ask for voluntary contributions of each person that lives in the city of Tower, and they're only able to generate about $40,000 a year. So when you look at the city of Tower, it's not working there. It's not working for the people who live there. It's not working for the people who vacation there. I also think about the city of Ely, and I think that one was really telling for me. So I lived in Ely for 5 years. So maybe I'm a honorary ranger, I don't know, but I lived up there, I went to college, and I worked up there. And I think Ely was really was impressive in a very bad way. And I'm not saying these things to disparage these folks because they're doing the best that they can with the resources that they have. But again, for 8 to 10 years, we know that this was a problem and we did nothing. This entire body, this entire state legislature did nothing for the last 10 years. We set up an EMS board. We expected them to do what they were supposed to do. They failed. They failed us. And it is time for a regulation change. But, the city of Ely, transfers are skyrocketing to Duluth, and that's a long distance. That's not just an easy jaunt. Nurses are grieving for their patients. That was said when we were at the event in Mountain Iron. EMS is burdened and spilling over to other medical staff as well. They're having a hard time getting life links. They actually provided a story where one person was a patient with a heart condition. The closest heart care treatment was in Duluth, and they had a hard time trying to find transport to Duluth for 48 hours. Now, in a situation like that, that could be a person who lives there. That could be a person who's vacationing there. It doesn't really matter. We are failing, and the state of Minnesota, the EMS that we have right now is failing. We have to do something. We have to do something this year. We're going to have to do something next year. We're going to have to keep doing things for the next 5 to 10 years. In my mind, I'm imagining, because it's not something that we have silver bullets here. We can all say that we have these perfect ideas, but they're not silver bullets. And at the end of the day, what's working maybe in one part of the state isn't going to work in another part of the state. Does that mean we're going to quit? Does that mean we're going to give up? No, that means we're going to double down and we're going to try to work together. That was the intentions of having this EMS task force, was it was supposed to be bipartisan, bicameral, and we were supposed to do things together. And I think it was really interesting to me that halfway through this legislative session, there was a press conference where only half of the members of the EMS task force were invited. Half of those members declined to participate because it was a partisan press conference, not a bipartisan conference. And I think that that's really important. Madam Speaker, can I ask a question of Representative Backer?
Are you asking Representative Backer to yield?
Yes, please.
Representative Backer? Representative Brand.
Thank you, Madam Speaker. Representative Backer. So we serve on the task force together. And I think it's really interesting that we talk about certain numbers, and we're on the task force together, and I've asked other members that are here today for some more information. There was a conversation about 122 million somewhere there in a previous amendment. Can you tell me where that number actually comes from? And can you give me some of the resources? Because as a member of the task force, I don't actually know where that $120 million come from, and I don't know where that number was derived.
Representative Backer.
Yeah, Madam Speaker, thank you. Member, how that number was generated is we look at the volunteer hours that are provided by a service, okay, like myself, moi in French, if we're speaking French on the floor here. So we look at the amount of hours that the volunteers serve. We look at the number of calls that you have. And then what we look at is we look at the operational of that service. And when you start to look at all those services combined, and I worked with the Greater Minnesota City as a Coalition and other, like the Minnesota Ambulance Association and other individuals, to understand those numbers. At the end of the day, and we've had members on the task force, and it has truly been a great pleasure to serve with you. Enjoyed being down in Mankato in your backyard. At the end of the day, volunteers are still subsidizing the back of our industry. And when you start to put those numbers in, when you start to look at the operational of the ambulance, when you start to look at the capital resources, and we're not talking about a $730 million palace for politicians. We're talking about a basic ambulance rate. I know up in one county of mine, they're looking at a new ambulance, $300,000. 2 years ago, we got one. We actually, so we could afford it. We had to remove the old box and took that and put it on a new ambulance, a 1990 box, because we saved $100,000. Because where did we get that money from? We got that money from the pancake feeds that my wife and I and my twin brother has been doing for the last 26 years. So that's what went into that formula. It was not something pulled from the pie in the sky. There was assumptions made about how much you would get per if volunteer compared to an EMT. So those are real numbers and so forth. So thanks for asking.
Representative Brand.
Thank you, Madam Speaker. Thank you, Representative Backer. I think it's really important that we get the numbers right. And I think it's really important that we don't just get the numbers right this year, but we look about it in the next biennium and we look at the next biennium after that. This is something that's not going to go away. This is something that's been percolating, something that's been boiling over for the last 8 to 10 years. And I think it's really important that we don't just expect that we're going to rest our laurels on one number and walk away and say we did it, and then that's it. And I think that really, I was a little skeptical of this bill, I have to admit. Representative Huot, when he first brought this idea to me, I was a little skeptical of this. But then I thought a little bit more about that. There are a lot of people out there that are kind of just drifting out there, doing their jobs day after day, taking care of their neighbors, taking care of their friends and family members in their communities. They need help, they need support. And I really do think that this board can actually give them the support that they need to be successful in their jobs, but also to help with things like recruitment and to make sure that these sprinters are help in the needs where there's multiple need in the same area at the same time, where there's not an opportunity to have 365-day service, 24 hours, 7 days a week. I'm thinking of when we were back in Mountain Iron, I took a lot of good notes, but one that I wanted to bring up was one that Lance Tobke from Nashwauk mentioned. He said that money wasn't entirely the problem. If you don't have the right people to solve the problem, pressure is going to build in neighboring towns, and there just isn't enough people power in some of these communities. We all represent communities that are pretty small in greater Minnesota. Maybe not in the metro area, but especially in greater Minnesota. We've got communities that are drying up. The old idea that you could volunteer but also work in the community that you lived in is kind of a far-gone conclusion, because nowadays you have to drive for a job in greater Minnesota. In my particular district, it's 10 miles from everywhere. 10 miles from your job, 10 miles from the grocery store. There was a movie once that said something about being a geographic oddity. Well, in my particular district, it's a geographic oddity. It's 10 miles from everywhere. But at the end of the day, you have to have good, reliable service, and at the end of the day, you have to have volunteers in your community, or it's just not going to work. Thank goodness we do have volunteers to help out in things like our fire department in St. Peter, but it was about 10 years ago when I was in the city council in St. Peter, we actually could not fill the police, or the ambulance with the amount of people needed to do a run, so we actually had to start contracting out our service. And that contracting out has worked better because now we have people that are reliably there at all the times. But what that does is it actually costs the taxpayers of St. Peter a little bit more because it's on a contract basis, and of course contracts sometimes can raise the price. I think at the end of the day, we do need to look at money, but I don't think that's entirely the whole thing. I think we have to start looking at recruitment, and that's going to take specific dollars as well. I also really do think that we need to get some more support in some of these communities so they can continue to do things that make sense for them as well. I'll leave you with one last thing because it's really important. When we were talking about some of those particular districts where that money could go, those are the ones that I think if you look at a heat map, those are the ones that are red hot. I'm thinking about folks like, Tower, Minnesota. They have to cover a wide range in their area. That includes state parks. There's 3 state parks in their jurisdiction. There's also a national park in their jurisdiction. And oh, by the way, the Boundary Waters Canoe Area Wilderness. That poses different dynamic challenges than in my particular district and in a lot of your districts as well. And so I think at the end of the day, we're asking a lot of people to do a lot of things. Sometimes they're actually subsidizing it as well, like Representative Backer was saying. And that's really important that we stop that from happening, because at the end of the day, people are losing money, and people are burning out, and people are getting older, and there's nobody in the waiting room waiting to take over for those jobs. And so when we got 50 and 60-year-olds that are doing lifts that 20 and 30-year-olds something should be doing, It's really important that we start looking at that. Now, we've got some numbers, we've got some data, and I'm sure that Representative Huot can mention some of that stuff later, but at the end of the day, one of the things we know is that we are losing our 30 to 40-year-olds. We need to keep those folks. We need to get more 20-year-olds included. That's why I've got a bonding proposal to actually help with EMS education in my particular district at a two-year college. At the end of the day, there are a lot of things we need to do, but the last thing I think we need to do is start fighting each other, and I think we need to fight for the people that we represent in those communities that need it the most. Thank you very much, Madam Speaker.
I recognize the member from Olmsted, Representative Quam.
Thank you, Madam Speaker. Would the author of the bill yield to a question?
He will yield. Representative Quam.
Thank you. I heard the author mention multiple times referencing waste, fraud, and abuse. Can you specifically list the waste, fraud, and abuse that was noted in the audit?
Representative Huot.
Thank you, Madam Speaker. Thank you, Representative Quam. No, there was no waste, fraud, and, well, I'm sorry, I say it abuse, waste, and fraud. There was not any, but we don't want any to happen. That's what this is about. That's putting the parameters in place with this department. That's all this is about. Making sure that we have a landing pad so we can start, all of us know in this room, we are going to start writing checks to EMS. We need to make sure there's an agency that can handle that we can trust, that we can go forward with. I'm telling you right now that this is a problem around the country. I don't want it here. So I am putting forth the guardrails for us to do what we need to do. Thank you, Representative Quam.
Representative Quam.
Thank you, Madam Speaker. And 10 years before that audit came out, I was on the EMSRB. And while it wasn't perfect, it was functioning fairly well. One thing I did notice is that we probably need to be careful of who we put in charge. I felt we needed maybe more people directly with the background. Not so much, project management, but more of a person that knew the functions. And so I, frankly, liked the MSRB. Of course, that was, about almost a decade and a half ago, not quite. And at that same time, I got to work with a lot of the people because I was the original chief author on the community paramedic bill. Someone wanted to take over chief author. I did that, but I said I will be engaged, and I was, because that added things for greater Minnesota. One of the things at the same time, I knew some of the people involved there because several members of my immediate family were they were on a volunteer ambulance service, and several members were on a first responder squad, and my wife actually, for about a decade, was the head of that first responder squad. And I heard the pager go off and the calls. And I also didn't hear specifics, but I did hear a lot of over the years, what are we going to do when so-and-so is moving or retiring? This decrease in bodies is not new. It's been around a while, but it's being hit hard because a lot of the people that were active a decade ago are reaching an age where it's difficult for them. Frankly, I had hoped that we would be more focused on fixing and enabling, which the amendments tried to do, instead of a total change, because the audit, been on the Audit Commission again for almost a decade and a half, and the audit basically was indicating we probably need to look at who and how we appoint and the structure of the EMSRB to improve it and isolate it from the effects when you appoint and have those transitions. But my concern is with this reorganization, it takes time to figure out and get the other organization, and then that organization takes time to come up. And I don't want to use that as an excuse to not actually address things now. I don't want to wait years. Oh, we're going to change this, it'll be great. Because I know about the people that it matters to tomorrow, next week, next month. Most calls are pretty tough. I remember a few calls where you could see something good happened and a life was saved, and it wouldn't have been saved if they hadn't been there. The biggest joy I saw was when my wife came back from a call where she delivered her first baby on a call. And that was pretty cool. But I remember the tough calls, which tear at the people. And you need to have the support for the people, because call after call, after a while that gets to a person. I remember when my wife came back from a call, it was the husband of someone that was on the squad that she knew well. Massive heart attack, brought him back, but he didn't make it. And those add up and hurt, and we need to look at how we can help those people in those tough times, because it's not an easy job. There are a lot of differences between the different parts of the state. In my area, we've got volunteer ambulance services. We've got some things can sort of be run through the fire department, and others have first responders that basically go there, do everything but transport. And then sometimes, if it's a major issue, my wife's driven the ambulance while the two people that came in with the ambulance were caring for the person. It is that variety of, volunteer, professional, what group does it, that we need to look at across the state. Not for this, you do that. It's not the medical training, but it is the variation across the state. And that's why I think that we, frankly, should do what the auditor suggested and improve the EMSRB and get things supporting and helping instead of throwing it out. Because I listened to the testifier after testifier after testifier when this bill was before committee. And every testifier seemed to have concern with this bill and the throwing out of the current board and forming a new one. So I'm going to vote no on this bill because I listened to all of those first responders, EMTs, ambulance people that actually testified in committee on this bill.
The member from Moller, Representative Mueller.
Thank you, Madam Speaker, and thank you, members. And before I make my comments, thank you, Representative Huot, for the work that you do. Thank you, Representative Backer, for the work that you do. As a person with a critical illness, I rely heavily on knowing that people are going to come when I have to call 911 or when my husband has to call 911. So thank you. I know it's not easy. Just like we talk about with the law enforcement, the things that our paramedics see, we may never, ever see in our lives. And that is hard and often traumatic. And so I really, truly thank you for the work and the commitment that you have to public safety and to the service here in Minnesota. With that said, I can't support this bill today. And one of the reasons why is because of the fact that I am just so concerned with how this kind of upside down idea of creating innovation through creating more bureaucracy. I'm frustrated with that. I'm frustrated with the idea that we would have a task force where we listen to what they need, but then not actually do what they tell us that they need. I'm frustrated with the idea that we are taking priorities that we have heard from our constituents, from the ambulance services, and yet telling them, just kidding, you need this instead. I'm frustrated with that. I've listened to many of the comments. Several people have talked about how, we need the right people. There's not enough people power, and we need the right people to solve the problem. Well, that's more EMTs. That's not more FTEs in St. Paul. More people who are going to solve the problem, that's going to be more EMTs, not FTEs in St. Paul. We heard about response time and how important it is for us to look at response time. That is going to be solved with more EMTs, not more FTEs in St. Paul. This is a core function of government. Everyone expects to get service when they pick up the phone and dial 911. Everyone expects it. It is an expectation of this country, and it is a core function of government. And yet the priorities that we've heard from the other side of the aisle is not this. Priorities was also mentioned in the letter that was given to us by Representative Backer from the Minnesota Ambulance Association. The prioritization of regulatory efforts, such as establishing an Office of EMS, along with the pilot program, do little to ensure that an ambulance will be there to answer the call. Listen, the Office of EMS will actually have nothing to regulate if there's no more ambulance services. There's nothing else to regulate for this board if there are no more people to run the ambulances and there's no more ambulances to answer the call. They've asked for funding. They've asked for more money. They've asked for us to invest in them because, like Representative Brand said, this is something that has been underinvested in and is just boiling over the surface. Layer upon layer of bureaucracy is not how we're able to get more people. When we talk about retention, not only does it require money, but it requires breaking barriers like what we did in the amendment of 12-1 in Article 3, where we opened up more opportunities. That's the type of thing where we foster innovation instead of stifling it through more bureaucracy in St. Paul. I'll end with the idea that we fund what we value. We fund our morals. I've been told that so many times from the moment I was a legislator from the other side of the aisle. We fund what we value. If we look at dollar amount alone, what we're showing the Minnesota people is that we value government more than our EMTs. That is what we are showing through the budget that we are putting forth and the money that we're spending today. We are showing them through the money that has been allocated. We value buildings in St. Paul for politicians more than a core function of government that everyone relies on their worst days. Members, I urge you to vote no.
The member from Isenti, Representative Johnson.
Madam Speaker, members, our EMS system is in crisis. We have problems with retention, recruitment, and reimbursement. This bill doesn't fix any of that. While we have a big hole in the ground for the palace for politicians costing over $730 million. We could have put the $126 million into this program to help our EMS system, which is one of the core duties in our Constitution for the state to do. Last year, we spent $17.8 billion, raised taxes another $10 billion. So we spent $37 billion, increasing our state budget by almost 40%. And we had to fight tooth and nail to get some small amount of money for our nursing homes, and we did nothing for our ambulance service. I myself have served on an ambulance service and understand what they go through. Mine was a semi-volunteer where you volunteered, you got a little stipend while you were on call, a little better pay if you got a call. You were paid by call, not hour. And a lot of respect for the members that I worked with. A lot of employers in my community, at the time I lived in Braham, they would be at work, and when the pagers went off, their employer said, go ahead, we need the ambulance service. And they'd leave their job and go take care of the person that was sick or injured. We have great EMS personnel. I consider them some of the best in the country. But we're hurting on recruitment, retention, and reimbursement. Unfortunately, this bill funds more FTEs in St. Paul than it does our EMTs that we need across this state. Looking at the bill, we currently have, I was wrong earlier, we actually have 17 members on the current Emergency Medical Services Board. 2 of them are commissioners, Commissioner of Health and the Commissioner of Public Safety. One of them is a member of this body. I believe that's Representative Huot. But all 17 have to be appointed by the governor. Granted, they have to, if I remember correctly, they have to be approved by the Senate, but they're appointed by the governor. I was just looking at the duties of the current board. With the problems they're facing, there's not a whole lot that board can do. One of the things they should do, and hopefully they have been, but I haven't heard of anything, is listed number 3 on their list of duties. And that is make recommendations to the legislature on improving the access, delivery, and efficiency of the state emergency medical services delivery system. Would Representative Huot yield for a question?
He will yield. Representative Johnson.
Representative Huot, as the representative for this body on this board, have they provided you any recommendations dealing with the implementation and making our system better?
Representative Huot.
Madam Speaker, Representative Johnson, funny you should ask that, because that's what I'm doing here today. I was really disappointed this year on my last board meeting when I went, and they advised me, and I made it clear to them that I'm looking at this, and they advised me, you know what, we're going to meet every other month instead of every month. They knew what I was doing. They knew where I wanted to go. To be honest with you, I didn't want to do this year. But when they took that move, I knew what my next move had to be. Have they advised us? That's what I'm mad about. I'm mad about because Representative Backer and I and the members of the committee had to come up with a sprint medic model. We had to come in as legislators and try to fix this board. That's what the problem is here, is the board is failing. And we can go down who appointed them, but I'll tell you, this board has a history, as Representative Quam just said. In 2002, there was a report done, and the board continued to fail. It's an industry-driven board that is failing because they take care of the home base, which could be whatever ambulance service they're with. That's what the problem is here, and I get it. I did not want to bring this bill forward. I just did not. But my colleagues over here said, you know what you have to do. The last thing I wanted to do is have this argument on the floor. So no, the board continues to fail. I mean, yes, they did some bandage work and answered the audit and all that stuff, and we have all seen that. In my short time here in 6 years, I've seen more of these audits like that. But the board has continued to fail us. And one of the other things, I'm just gonna say it right now, if you're appointed to a board, doggone it, go to the meetings. Part of the problem here is that we had members that were appointed to this board over time that did not show up. If you have the honor of being appointed to a board, please do that, because you know who you represent? You represent us. You represent this body. You need to go to those meetings. Thank you, Representative Johnson.
Representative Johnson.
Madam Speaker, would Representative Huot yield to another question?
He will yield. Representative Johnson.
Now, my understanding, Representative Huot, that this recommendation that on this bill came from the task force. Is the task force the board, or is that a separate entity?
Representative Huot.
So we do have a split opinion on, I'm sorry, Madam Speaker, Representative Johnson. We do have a split recommendation here. All senators that sit on the board right now, Republican and Democrat, some that are totally opposite of me, recommend this. All House members on this side of the aisle recommend this. Your members don't want it. And that's fine. That's what this is about. That's what the debate is. This was not, we don't have to have consensus, as we all know. But we could not do nothing. And that's what I just heard Representative Quam say. When were we going to do something? We can't wait this long. If you look, the Sprint Medic model goes into play this year. We would expect that the current office start the conversion. We would expect that they start filling the gaps around the state. We would expect things to start happening. I would have expected that after the audits. But all they did is placate what was in the audit, not what we had to do to make it better. And to go to the audit again, 2 members, Representative Hansen, after he heard the audit, called for the immediate resignation of the board. So I'm just having some trouble with this, and I know the board is not the task force. The task force was put together by the Speaker, and we brought Republicans and Democrats together. The task force is still active. We're not done yet. Our work is not done. We have one of the biggest hurdles to do on the task force, and that is simply finding out how we're going to pay for this. Because you're right, anybody that's in this room knows that this is not the number. And here's the other thing, when I keep hearing it back and forth, is that we didn't do this last year when we had a surplus. Why didn't we do it last year? I would like to know that, because you know what? Here's what I was told about the 120. I had a mayor up north, and I'm not going to sell him out, but he said, John, this is what you have to do because we deserve ours now. The nursing homes got $300 million from you. We got nothing. It's our turn. That was his justification for the money. None of us want to hear that. We want any money we spend going forward to make sure it makes a difference. Thank you, Representative Johnson.
Representative Johnson.
Well, there we have it, members. This isn't a recommendation from the board. This is a recommendation from a task force put together because the governor appointees on this board didn't do their job. They didn't make any recommendations to the legislature. Although we have members sitting on that board that could have requested them, but we did not have any recommendations. Now we have going from one board with 17 members to 3 boards with 35 members, 18 on one, 11 on another, 6 on one. 35 people, and I've been on a number of boards before. I brought legislation that was requested by them to this board, to this body, and had it passed. But I also know that when boards get too big, they're doomed to failure. This is getting way too big. This is too many FTEs and not enough EMTs. We need to find out ways that we can recruit more people. We can retain them in those duties. And here's the biggest problem that our ambulance services are having is reimbursement, especially in greater Minnesota, the best part of this state, away from all these street lights, where you can actually see the stars. You can see the comets. You can see the space station as it's going overhead. The problem we have is in the reimbursement rate with Medicaid and Medicare. It doesn't cover the cost. In greater Minnesota, we have a lot higher population on those services. And we have a push in this body to put more of them on that. And guess what? Not only our ambulance services and our EMS is going to suffer, our hospitals and clinics will suffer as well. We have a number of hospitals that are actually in dire shape right now. We need to fix that problem. Instead of fixing the problem, we're setting up a board with no funding to implement anything they would like to do, having more FTEs than EMTs, delegating authority to a new office, and allowing them to overregulate our EMS with minimal checks on their power. We're creating more bureaucracy that does not fix the problem. We need to find a better way. We need to find a way to let the communities do what's best for their communities. I know in my area, we had a fire department that wanted to set up an ambulance service. But because of all the regulations and everything else, it wasn't affordable. We need to find a way to get medical costs down. And that starts with something that nobody ever wants to talk about here, and that's tort reform. To cut down the cost of insurance. And that's the biggest driver of medical costs is the insurance costs. Members, this is not the way to fix this issue. Please vote against this bill.
The member from Olmsted, Representative Liebling.
Thank you, Madam Speaker, and I rise to support this bill and to thank Representative Huot for his incredible hard work on this and his courage in standing up to people who don't want any change. And I don't want to repeat things that have been said here. We all know that this is a core function of government. I believe, and I know all of you believe, that wherever you live in the state of Minnesota, when you call that ambulance, it ought to come well equipped with people who know what to do, and it ought to come in a reasonable amount of time. I think we all agree with that. And the question is, how do we get there? Because we don't have that now. And it impacts not only the people who live in different places in the state and their lives and their health, but it also impacts their economies, because who wants to move to a place where you don't have a decent ambulance service if you need it? Where if you want to have a child and you go into labor, you can't count on getting the transport you need. So this is really important for all of us. And this is not a private issue. It is a public issue. There's been a lot of discussion here on the floor about the money, and I've been looking at these two letters that landed on my desk. You know, one of them, of course, from the fire chiefs who support this bill, and the other from the Ambulance Association. And I keep reading this letter, and it's really clear that what the Ambulance Association is saying is, give us money, and don't worry so much about the reform. Well, I have to tell you, as a finance chair who oversees some of our health budget, I'm not willing to do that. You know, you all on the other side, the Republicans in this body, talk a lot about the problem of funding things without proper oversight. It's very, very clear that the current board cannot give the proper oversight. We cannot have the industry policing itself. The industry cannot be its own regulator, and that's what we've had for a very long time. And I think that we here will be willing to put more money into necessary services later on when we have assurance that it will be done in a good way, in a way that's not wasteful, in a way that's not being done through any kind of cronyism, but in a way that's related to need and fairness, as much as we can ever do that here in distributing resources. And that's why we need to change this model. We are not going to be able to put in resources and make the changes we need to make unless we change the way we regulate this industry. And that is what this is about. And I just so appreciate Representative Huot and all the other members in both bodies who have worked on this issue and who are willing to make a change and to stand up to pressure, because change is hard. We said this in committee, right? People don't like change. Everybody worries that you're going to lose something you've got and that it won't be better. But we have to make change here. People's lives are in the balance, and the economy in this state is in the balance. And I urge members to vote yes on this bill.
The member from Pope, Representative Anderson.
Thanks, Madam Speaker and members. And Representative Liebling, I agree with some of the things you say. We do need some reform, but you know, there's 2 weeks left in the session, and we've been at this problem for the entire session. So I think there's a growing impatience, and if we have to tear down the entire structure in order to begin the process of reform, it's going to take a while. And you know, the clock is ticking, I think. And I also agree that this is a basic function of our government. You know, we do the public safety and the education, and there's 3 of them. Forgot the other one. But anyway, and this rises to that same level. When you have an emergency, you pick up the phone, you expect somebody to be there, and in some cases that's not happening now. But I think we in this body are fortunate to have people on both sides of the aisle that live this stuff every day. Representative Huot, Representative Backer, maybe it's every weekend, but you live this stuff and you're passionate, and thank you for your work on it. But I think if this is all we get done this session, and we don't know how this session is going to end, if there's going to be another bill with some funding, great. If not, we don't really know how things are going to end. But I have the suspicion that if this is all we get done this session, you know, we're taking away the current system and putting in a whole new operational system we call bureaucracy, adding to the number of folks involved in this. And what is there, $6 million in this bill as well, which is less than 5% of what the ask is from the folks outstate and all over the state. And they've been asking for this the entire session, saying their needs are extremely critical and have to have some infusions of operating money sooner rather than later, or some of these systems may not be here too much longer. But I would encourage all of us to work together and add to this. If we need to change the way this is operated, make it better, that could be good. But they also need the funding, and we are going to be working on that, hopefully, and so that we can tell our folks who run these systems back in our towns and our districts that there will be help there and regulations as well as funding. So I would just encourage all of us to look at the bigger picture, and if we improve this part of it, but we also need the funding. That's a key part to get these systems back in the operational black, as we call it, in good financial standing, because they're so important. We all need them, and Minnesota is blessed to have good systems and good people, and we want to keep it that way. Thank you, Madam Speaker.
The member from Goodhue, Representative Altendorf.
Thank you, Madam Speaker, and thank you, members. After listening to this discussion, I wasn't necessarily going to talk on this topic. However, this truly is a top priority in my district, and I know many other are really struggling with their EMS services and the shortage of money. And I just really was taken back hearing that this is the solution that we've come up with, that this is the best that we can do for our EMS services. When they are crying, they need retention, they are suffering from a workforce shortage, so they need to recruit, and of course they need reimbursement. And what is our solution, and what is the majority party solution, which we always go back to here in this body? It is grow government. Grow government. And it is just being so tone deaf to the needs of Minnesotans. Just like last year when Representative Huot brought up that the nursing homes got $300 million. Well, that happened really near to the end of the session, and the Republicans were fighting for that $300 million the whole session. And now here we are again, misplaced priorities. Our EMS services are certainly suffering, and we are fighting for them to stay open, to be working, so that when our loved ones need this service, it is available to them. Again, the solution was growing government. That's what the majority party came up with today. More FTEs and not enough EMTs. Nothing is being solved with this bill. It is creating another agency and growing government. Vote no.
The member from Traverse, Representative Backer.
Thank you, Madam Speaker. First of all, would the author yield for a question?
You will yield, Representative Backer.
You know, you've stated this at the beginning of the call, at the beginning and a couple other times, and if it's happening, I want to make sure we do something about it. You stated that there is waste, fraud, and abuse in EMS here in Minnesota. And as you know, since local governments hold over 50% of the ambulance license, can you please provide a specific example which Minnesota units of government you were talking about, Representative Huot?
Representative Huot.
Madam Speaker, Representative Backer, I'm sorry I did not understand the question. Do you want me to answer of ambulance services I know that have had charges brought against them? If that's the question, no. And I go back to what I said earlier. If we want more money, at least I can speak for my side. We want a landing place that's going to have guardrails. Have guardrails, and that's what this agency is doing. So I'm not accusing anybody of fraud and abuse. Now, like I also said earlier, that if you want to look it up, go online. Put ambulance fraud in the computer and see what comes back. It's an industry through the nation that had problems, but part of the problem with that is that they don't have the training they need. These aren't financial people. They're like you and I, Representative Backer. We're simple people. We're not complicated. You throw a Medicare coding at us and we don't do well at that. I don't think it's ever intentional, but it happens. And so we just have to make sure when we're using the public's money to fund EMS that there's a landing pad that we all can trust. Thank you, Representative Backer.
Representative Backer.
Yeah, thank you, Madam Speaker. You know, when we look at the OLA report, one of the things that it did say should improve its oversight in the executive director. And I would agree with that. There needed to be oversight, a stronger oversight. But nothing in that report takes it from one side way over to government. We heard on the House floor here today, we need an agency because we can trust them. We could probably spend 4 or 5 hours on listing all the agencies that have not been good stewards of taxpayers' money. And currently the executive director is doing a phenomenal job. Can there be room for improvement? I would agree with that. But going to an agency like what we're seeing that is actually tripling this, and as this grows, we're going to see more FTEs than EMTs. And that's because we're not addressing those 3 things: recruitment, reimbursement, and retention. Now, first of all, there are, I think I'm representing Huot, it takes a special breed to be a paramedic and an EMT. And I like to do a shout out and thank all my fellow providers out there who have been called, just like a firefighter, just like the military, we run to danger. That's what we're called to do. The challenge that we have with this bill is like the run that I had on April 20th this year. We had a call at 10 o'clock at night, was going hit the hay or go to bed, and it was full cardiac arrest. Pager came off. And I know I've shared this to some folks, but there has been times just last week that we had no EMTs in the Browns Valley Ambulance Service. Very thankful that night. Pager went off. It was a witness arrest. So that means the wife started to do CPR on the gentleman. First responder was on the scene in 3 minutes. I was in the ambulance in 2 minutes, got over there in 7 minutes to Beardsley, Minnesota. By that time, they have shocked that gentleman 3 times. And I was there for the 4th time, still did not come back because we had the EMT. So we put the gentleman in the rig. I hopped in. The next partner of mine who had the most level of training hopped in. And within 3 minutes in the back of the ambulance, he started to breathe. And that's quite a feeling. There is no agency that can replace that. This bill does not replace people like me. It doesn't. And this person is getting tired. Those runs are very stressful. That was pleasant. I mean, that's my 4th save in 29 years. And that's the challenge that I have is when we're out in the field. I've had the opportunity to haul my grandmother in the back of the rig, respond to my brother who was in a car accident, and about 50% of the people in the area I know. And we need more folks like myself. We do not need a larger government presence. This board, with some changes, could do the job that I think you're looking for representing Huot. It's not broken. If it was broken, you were with me all but one time. I know you were gone, and I'm not going to slight that at all. That's not what I'm saying. But we kept hearing out there, retention, recruitment, reimbursement. There was no one saying that we needed to change the board. Because quite frankly, we have a great director right now. I'll have a shout out. He's doing an awesome job. The bill last year that we had, or that Senator Lang had with some oversight changes on the board, I think is the best way. I am so concerned with this agency. We will have a czar that will direct because of the huge amount of rulemaking. And when you don't have that check and balance, I had some great amendments, at least I thought so. that would give some balance. Hear from folks like you and I, Representative Huot, who actually serves, who is on the front line, who has to be there and give a hug to a person who just lost their husband or lost their 21-week-old infant. You need that first line. You need the providers to be part of it. And I know you've worked hard. You and I agree on a lot of stuff, but this is where we're going to have the biggest disagreement, because I've not seen St. Paul with education, with feeding the future, are creative enough to make things happen like what we do in West Central Minnesota. And the last example I will share actually comes from a testimony up in Mountain Iron. I remember this. We're up at Representative Lissegard. We had about 2.5 hour testimonies. And the gentleman comes up. He said the most, he's in the least amount of time. And he asked, last year, because this was what month was this? I don't even remember what month it was. I think it was the beginning before session this year, I think January. He asked, last year, did you guys, did the Minnesota House and Senate and the governor sign into law a certain dollar amount for electric scooters? And he said, yes. And he said, did you prioritize any funding for those individuals if they get in an accident? And of course, we had to say no. Funding is what we need, folks. I want to get that money down to our local providers who knows how to use it, and then continue to work on this. So members, I do appreciate your effort, Representative Huot. I mean that sincerely, but this is not the right avenue. I would ask for a red vote, members. Thank you.
The member from Stearns, Minority Leader Damath.
Thank you, Madam Speaker. And members, as we have heard the details of this bill, the concerns over the lack of funding, the concerns over priority, again, I just want to point out, we heard from the bill author that this is the regulatory bill without the funding. But it takes all of it to make this work and make Minnesota safer. The EMS funding, as you have heard, is struggling across the state. The amount is staggering, $120 million shortfall. We know we have a looming deficit here in the legislature because of what was spent. They have a deficit now, and it affects public safety across the state. Democrats in this chamber have allocated just $6 million to address this, and that is very, very short-sighted. We know that the money, as we have heard earlier, why didn't it happen last year? And the answer was, we don't know. The majority didn't know why it didn't happen last year. But yet it was a priority to spend $730 million on an office building for a part-time legislature. And I'm sure as you have heard that repeated day in and day out on this House floor, the majority's probably tired of that, but the public is just starting to wake up. The public is just starting to recognize that $730 million of taxpayer dollars are going into a pit across the street to build a palace for politicians that are only part-time. Yet when you are in another part of the state and calling 911 and need a response immediately and there's a delay, a palace for politicians is not going to help you in your time of need. The consequences, without adequate funding, we know that EMS providers are going to struggle to recruit and retain the skilled personnel, to maintain the life-saving equipment, and then to respond promptly to the emergencies that are going to happen. And lives literally are going to hang in the balance. This, members, is the EMS service across the state calling 911 to the legislature, saying, help us, help our communities. Do something because you are the ones that have the power to do it. This side of the aisle is saying, majority, do something. You have the power to do something. But unfortunately, what we are seeing is the way of the majority doing something as simply a bill that triples the bureaucracy. You are prioritizing FTEs over EMTs in the state of Minnesota. We have got to prioritize the health, well-being, and safety of our communities by fully committing to the need of EMS across the state. We cannot afford to compromise public safety. It is our duty to budget resources responsibly, to prioritize the needs of our constituents, and that time for action is just in a couple of minutes when you can choose to either vote for this bill or vote no, take a look at it to make changes in the few days, the few hours that we have left to do something that would actually make meaningful change for EMS services in Minnesota. Members, I encourage a no vote on this bill.
I recognize the author of the bill, Representative Huot.
Thank you, Madam Speaker. And Leader DeMuth, I'm glad that you think we're going to be doing this quick, because I have about 90 minutes here. Joking. So thank you, members. This definitely was a robust debate today. One thing I picked up on this is we all care. We all care about what's going on in Minnesota with EMS. And I hope you keep the same spirit you used today as we go forward, because we're going to have some more hard bills to vote on. We're going to, when the funding actually gets settled, and I have faith in your leader and ours, that we will have a number sometime. And that we will have to decide which way we go here. I do want to go back to a couple of questions. What did we do last year? And I have to go ahead and correct the statement here. Last year, EMS wasn't at the table. And I was on the board. There was no recommendation for any big money. Again, I go back to the statement from the person up north that told me why they deserve the money. Now, they do need money. That's not a question. But last year, we did do stuff. Chair Joachim put money in the education bill so we can get EMTs in high school. Chair Pulowski put money in higher ed so we can start medic programs. Representative Chair Liebling put money in her bill for EMT programs. We were building the bench together last year. We did do things right. And as far as FTEs, EMTs, whatever you're talking about there, yeah, we're going to add 2 FTEs to the agency. We're also going to add 6 FTE paramedics, ALS advanced, to those sprint cars that are going to go out and make response cut. We didn't hear anything about that, but we heard more about the bureaucracy we're building. Unfortunately, we need this. We need this because I didn't want to do this, trust me. I was being honest about having nightmares about Representative Nash and yelling at me about this. No, you're very constructive, you're right. I did not want to bring it to my members, my friends across the aisle, because I know where you're at. I know where your values are at. And this is really a hard thing to push. I don't want to go down as the person that created an agency, trust me. And I always went back to, you know what, this isn't going to matter in my area. This, you know, I have great EMS. I get response right away. We have great public safety all throughout. But then something weird happened this morning that just blew me away. It's your email trail that you go through and I'll go, gosh, wonder what this one wants again. I had 4 emails from people from the opposite party saying, this is important to me, John. This is the best legislation you've ever done. I was like, whoa, this is wild. So I know that this is a hard vote. I hope some of you are going to come over and join me. I know that Senator Lang, Senator Rasmussen are sponsors on this bill in the Senate. Something Representative Curran said that just blew me away when this bill was presented in the Senate, because him and I definitely are in different spectrums. He said, this is one of the best bills because he's on the audit commission and said, we need to fix this agency. This is an agency that needs this. So I just hope I'm not wrong, but this is what we have to do because we have to do it now. And we will continue together with Representative Backer and others that are on the task force and bring more ideas back to you next year. You have my guarantee on that. And we'll evaluate this agency as it goes along. So I got a couple thank yous to do because this was a big lift. First of all, Chair Liebling has been my mentor in this and has been my coach. And I have to be honest with you, Chair Liebling didn't think this was a great idea either. Neither did the Speaker at first. You're going to do what? And I remember bringing this to Representative Backer, and he goes, you want to create an agency? But 2 of those 3 came back to my side. So that, Chair Liebling, you've been great. I couldn't have done this, and again, without our staff. First of all, I don't know how people like Elizabeth work, but she was working for Jeff, Representative Backer, and me this week, and then we found out we had the same amendment going on. Our staff is great. I mean, and they're so confidential, and they don't sell us out, so I have to put it out for Elizabeth. She did a lot of work on this bill. Josh Sands, who's been traveling around the state with me, he's our CA for the task force. He'll continue. He's been great. The same with Jonah Westerman. Both those 2 didn't know anything about EMS, and they both stepped to the plate, and it was always fun to try to have to explain stuff to them, and I don't know how they understood me, but they did. So, members, I appreciate the debate. I look forward to more of your input, and I ask for a green vote. Thank you.
Seeing no further discussion, the clerk would take the roll. The chief clerk will call the names of the members voting remotely.
Carroll.
Carroll, aye.
Carroll, aye.
The clerk will close the roll. There being 70 ayes and 58 noes, the bill is passed as amended and its title agreed to. Motions and resolutions. Representative Long.
Madam Speaker, I move that House File 5216 be taken from the table.
Representative Long moves that House File 5216 be taken from the table. All those in favor say aye. Those opposed say no. The motion prevails. House File 5216 is taken from the table. The clerk will report the bill.
House File Number 5216, an act relating to state government, providing law for judiciary, public safety, and corrections, the second engrossment.
There are amendments at the desk. If there's no objection, we'll let the author explain the bill before we act on amendments. I recognize the author of the bill, Representative Becker-Finn.
Thank you, Madam Speaker, and tag teaming with my partner as in justice, as always, Chair Moller. So I will start with the judiciary portion of the bill. Members, this is the Judiciary and Public Safety Finance Bill. I'm going to actually start with the gratitude portion of this speech instead of doing it at the end. First and foremost, I want to thank my, previously my LA and now my committee administrator, Anna Borgerding. I've been incredibly fortunate to have the same staff person with me throughout many years here in the Capitol, which we all know is something that has no price. So thank you, Anna. Ella Schultz, my LA, as well as Zach Meinertz, our researcher. Also want to thank our committee page, Joe Schatz, as well as our nonpartisan team, John Walls, Ben Johnson, Mary Davis, Nathan Hopkins, and although he wasn't here for any of session, Jeff Debo, who did a lot of the work in the interim helping us prepare for session. position. Also wanted to thank Lead Scott. I have been very fortunate in that the minority lead on my committee, I think we have always done this work respectfully together, and I do really appreciate there's two women at the top getting the work done in Judiciary. And my Vice Chair Frazier, as well as some incredible first-term members and Representative Finke and Representative Curran. Last but not least, I want to thank the sergeant staff. Sergeant at Arms Lori Hodap, things often get heated outside of our committee with some of the topics that we address in Judiciary as well as public safety, and incredibly grateful to the work of sergeant staff and always being there when we need them and sometimes when we don't even know that we're going to need them. So just wanted to start with that gratitude instead of rushing through it at the end. As far as the bill, despite having obviously a much smaller target this year, we have some important things in the bill. First, court interpreters. Folks may have heard quite a bit about this in the interim. So our court interpreters, in addition to working in a deficit, the rate that we're paying them is just not enough. It's obviously incredibly important for people to get justice, for them to be able to communicate properly in the courtroom. So we are increasing the rate for court interpreters as well as adding some funding so that they can be reimbursed for their travel time throughout the state. Sort of the same sort of problem when it comes to forensic examiners. We're addressing a deficit there as well as increasing their rate ongoing. We have a Safe and Secure Courthouse grant program. That's been an ongoing grant program, but we're replenishing that fund. We also have some funding for enhancements in cybersecurity of the court system. And then finally, in the area of the juror program, there was a deficit for the courts there as well. And then a small item but ongoing, we will be funding trauma services for jurors, obviously, as you prepare to share a lot of information about yourself when you're getting ready for jury service, as well as some of the things you're exposed to if you're a juror on a trial. We want to make sure that we're recognizing the humanity of our jurors as they do that important work for us. And then finally, we're creating a board of civil legal aid. So right now, civil legal services are funded underneath the Supreme Court, and they're not technically their own separate board. We're essentially mirroring what we have with the Board of Public Defense, but with a board of civil legal aid, which just clarifies some things and gives a little bit more autonomy to the legal services folks, especially when it comes down to budget time. Two other quick things on the judiciary side. We've got some updates to the Safe at Home program. You know, there's always some little tweaks that we need to make there to make sure that it's functioning as best that it can, as well as a small change in our restorative practices. So folks may not be aware, this is a Representative Feist bill, but so if a kid gets in trouble with the law, right now under the law, a child may be ordered to pay restitution. Obviously, if a child can't legally work, it's kind of, I don't think your allowance is going to allow you to pay restitution. And so it's essentially putting families who don't have a lot of resources into an even bigger hole where they're already struggling. And so little tweak there. We didn't necessarily have the funding to do much there, but we've at least allowed restorative justice programs, if there's a way to forgive those financial deficits that folks may have. An example we heard in committee was kids detailing cars to do work to earn back the mistakes that they've made. So some good things in the bill. Look forward to moving it forward, and I will turn it over to Chair Moller. Thank you, Madam Speaker.
I recognize the author of the bill, Representative Moller.
Thank you, Madam Speaker. And I too want to start by thanking our staff in the Public Safety Committee. Ellen McDaniel, the committee administrator, is brilliant and did a fantastic job for us, along with Christian Lawrence, the committee legislative assistant, Maddie, our page, partisan staff, Zach Meinertz, John Holtquist, nonpartisan staff, some of whom we share with Judiciary, Ben Johnson, John Walls, Jeff Diebel, of course the revisor's office, and then the members, all the members of our committee. Special shout out to Vice Chair Feist, Lead Novotny, and again, just was a really great committee, and we had a lot of wonderful discussions. I also had on my notes that I wanted to make sure that we thanked the Sergeant at Arms and her staff, and Chair Becker-Finn and I did not discuss this in advance, but again want to thank the Sergeant at Arms, her staff. You really did show up for us for all our committee hearings here on the floor as well. And whenever any of us come to you with any concerns, you react with compassion, with kindness, and with swiftness. And we are so grateful for you and all that you do. So thank you very much. And now on to the bill. With the general fund dollars that we were allocated, we have two major buckets of funding. The first one is for the Department of Corrections deficiency funding. The bill funds their operating adjustment to cover increased compensation needs resulting from labor contract settlements to support retention and recruitment for corrections officers and staff across the department. And with this funding, with the contracts they just signed, they are at 97% staffing. They will be at 97% staffing, which is wonderful news. They had a workforce shortage there. And adequate staffing is important for the safety of all of the staff that are serving our correctional facilities, but also ensuring that people who are incarcerated have access to programming and other services that they need so that when they're released, they can be productive members of our communities. We also have another major bucket of funding for crime victim services at $9.5 million. Crime victim service funding is used to support victim survivors of sexual assault, domestic violence, child abuse, and general crime. The programs that provide these services across the state support annually more than 68,000 victims. These programs provide emergency shelter and crisis response, legal support, resources for healing, and other immediate needs like food and clothing. Crime victim services funding is a top priority this session, in large part because many of these programs have lacked an increase in funding for a while, and on top of that, they're experiencing significant cuts from federal dollars. We did last year try to close that gap with federal funding and giving them an additional increase, but the funds from the feds are actually depleting at a much greater rate than what was forecasted. We've heard that many organizations and shelters have had to limit their services. We even know of a shelter that had to shut down. And so I would just encourage members, if you, all of you have these programs in your district, when you're during the interim, go tour a shelter that's in your district and talk to the different crime victim advocates that are in your districts. The funding for these services has the support of 6 statewide advocacy organizations, as well as chiefs, sheriffs, local programs, county attorneys, schools, mental health professionals, and more. There will be a letter that's passed out on the floor today. I included all of those signatures because I hope that you'll take the time and look through at those signatures. You'll recognize some of the trusted community members who've signed on in support of this funding. I also just want to note that in the last week, with a couple of different bills on the floor, we have heard a lot of concern and support for victims of violence. I've heard colleagues across the aisle say things like focus on supporting victims, concern that we're leaving victims behind, focus on victims of felonies, we need to help victims of crime. Members, this is your opportunity today to support victims of crime with this bill, with this funding in this bill. With the remaining dollars that we have spent, we have a few different task forces, and we also have a first responder therapy dog grant program that Representative Moller brought to us. So that was an exciting day in committee when we had that presentation. We have a task force on domestic violence and firearms, a working group to look at motor vehicle registration compliance. Over the years, we've talked about trying to eliminate stops of motorists that aren't related to public safety, and the bill doesn't do that. But one of the things we want to look at is eliminating the stops for people not paying their taxes, essentially, who have expired tabs. If we were going to do something like that in the future, we want to make sure that people still pay for their car registration, and so this working group is going to look into that. And then we have a task force on the holistic and effective response to illicit drug use. That's based on a research report that we had commissioned last year, and now we're seeking stakeholder input to implement that into the law. And then finally, there's funding through a special revenue account for training and professional standards for 911 dispatchers. And I want to thank Representative Igo and Representative Wolgamott for their work on this issue. And with that, I look forward to the amendments and questions from members. Thank you.
Representative Perryman offers the following amendment. The clerk will report the amendment.
Perryman moves to amend House Law number 5216, the second engrossment. The amendment is coded A9.
I recognize the author of the amendment, Representative Perryman.
Thank you, Madam Chair. The A9 amendment adds language from a bill that I developed and dropped earlier in the session, House File 3945. And what it does is authorizes local governments to conduct a national criminal history check for applicants of a cabaret or massage business license. This is all in addition to what they do right now, and that is a state background check that they can do and are authorized to do at this time. The bill is also a result of sex traffickers who come to Minnesota to set up sex trafficking business that poses as a legitimate massage business. So let me repeat that. It's sex traffickers who come to Minnesota now and hurt our state to set up a sex trafficking business that poses as a legitimate massage business. There was a massage parlor in my area, Waite Park, and it opened up as a business. They went through all the state approval for licensing. Waite Park checked it all out, and everything went through and they opened up. And there was no issues with their state background check. However, the city would have had, if they had had access to national background check information, they would have found the applicants were part of a multi-state sex trafficking operation. That is because we only have, and our local governments only have privy to state background information. I am having a news story passed around right now about the sex trafficking business that happened in the Waite Park area. Sex trafficking operations are not confined to my area. I bet you can think through your head right now. You've read an article that was close to home, or you read an article in the state of Minnesota that the prayers were praying on and continuing with sex trafficking. So this is an issue statewide. I know this is not the first time this has been addressed in the House. In fact, I understand this bill was first introduced in 2019 at the prompting of the Lino Lakes police chief, who discovered the same issue in his city, and the inability for Lino Lakes to have access to national criminal history information on the applications for a massage business license caused this issue as well in his area. The Minnesota Sheriff's Association and the Minnesota Chiefs of Police Association supported the bill then, and I expect they will support it today. In fact, in the Waite Park, add a little side note, the Waite Park Chief of Police there, David Bentrud, has now retired. He's been retired now 2 years. But when I was understanding I was going to be able to offer this amendment, I called him Saturday and told him about this. And it was during also an event that Terabith was having, an event for raising money for sex trafficking mothers and women that are housed in St. Cloud in a housing to bring rehabilitation. They are so excited that this is coming through, and this is going to be a great amendment. The original bill, what's the difference? The original bill did include a broader group of business licenses. I, and working with others, decided to narrow this down so that we could really address the issue, and that is sex traffickers coming here under the pretense of a great massage parlor and passing state applications, but not understanding where they're coming from, that they may be carrying some issues from another state. And that's why we need the national criminal checking going on. So I ask for everyone's support, and I think it's a great bill, and it will help all Minnesota. And again, I just appreciate you considering it, and I look for a green vote. Thank you.
Discussion. I recognize the member from Ramsey, Representative Moller.
Thank you, Madam Speaker, and thank you, Representative Perryman, for your amendment. I'm going to recommend a green vote. It was a bill we were interested in hearing in committee, but we heard there might have been an issue at the time with the federal compliance, and we just didn't have the time to look into all of that. We have since learned that what we thought might have been an issue isn't actually an issue. And so I'm good with this language, and I'm going to recommend members vote yes. Thank you.
I recognize the member from Isanti, Representative Johnson.
Madam Speaker, members, Representative Perryman, thank you for this amendment. It's a very good one. Over the years, it's an issue that I've worked on myself. It's been in the Public Safety Bill, Judiciary Omnibus Bill more than once, and I'm hoping this time that the Senate does take this. This is important. Sex trafficking is a huge problem in this state. Some of you might not know it, but it is everywhere, not just in Waite Park, but it's had issues with it in Anoka County, in other counties all across the state. Because of the fact that the licensing by these cities cannot check the background in other states where they've been, these perpetrators have been caught before, they're able to get a license in the states, and unfortunately they're learning that they have that ability, so they are more and more are coming here, and we need to stop it now.
I recognize the member from Chisago, Representative New Brindley.
Thank you, Madam Speaker, and thank you, Representative Perryman, for the amendment, and thank you, Chair Moller, for your encouragement of a yes vote on this. I just, as soon as Representative Perryman brought this up and I learned about the amendment, I immediately went to the Google machine, because in 2015, here's the headline on KARE 11, North Branch Massage Spa busted for prostitution. I know this is the kind of thing that lives in the shadows, but it's real, and it's real in the cities, and it's real in our small communities, and this is a really easy resource to give to our local communities to provide better public safety for all of us. So thank you.
Further discussion. I recognize the author of the amendment, Representative Perryman.
Thank you, Madam Speaker. Thank you, Rep. Moller, for accepting it. Members of the House here, I'm really encourage a green board, to see a green board all lit up, but that's coming from me. But remember, your lead over there, Representative Moller, is supporting me as well. So listen to her wise words today, and let's have a green board, all right? Thank you, and do it for our public safety people. Thank you.
There being no further discussion, all those in favor of the amendment say aye. Those opposed say nay. The motion prevails and the amendment is adopted. There's an amendment at the desk. The clerk will report the amendment.
Novotny moves to amend House File Number 5216, the second engrossment as amended. The amendment is coded A10.
I recognize the author of the amendment, Representative Novotny.
Thank you, Madam Speaker. My amendment A10 fixes a couple provisions of the bill that I think would be very beneficial. They are areas that I understand are still being worked on and negotiated with some of the major law enforcement groups. And I believe that they can make this bill better, and it's something that, with these two out, I would recommend green vote, and we could move on to the next bill. But we've got some questions and some procedural things we're going to have to address if they don't come out. But let me talk about the amendment to start with. The amendment addresses two parts of the bill. First off, on line 26.14, talking about the traffic stops and questions. Now, I'll be the first to tell you that Chair Moller has worked with concerned stakeholders and has significantly pared down the bill, the language of the first bill. But what it is now is that on a traffic stop for 169 violations or 168 violations, which is the equipment sections that are commonly mentioned, that the peace officer must not ask the operator if they can identify the reason for the stop. The peace officer making a stop must inform the operator of the reason of the stop unless it would be unreasonable to do so under the totality of the circumstances. A peace officer's failure to comply with this section must not serve as the basis for exclusion of evidence or dismissal of a charge or citation. Section 645.241 does not apply to any violation in that section. That was put on, thank you, Chair Moller, at the last hearing that we had, which is, it does not establish a basis for a penalty if a peace officer making a traffic stop fails to follow the exact language used when making this stop. Couple concerns that I have and some of the stakeholder groups have expressed is that A, what if they don't say it exactly right? B, it's not the basis for an exclusion, but could it be partially considered? And C, is it a stakeholder that would be very easily changed in the future? D is, it's unneeded, it's more of a policy, it should be put into post board as a recommended policy. It's a law with no penalty, it's a law with exceptions that don't apply in certain circumstances. I don't know why it's in the bill. It's a non-law. These are laws. We don't need non-laws there. Would Representative Petersburg yield for a question?
He will yield. Representative Novotny.
Representative Petersburg, under the sections that I mentioned here, it's under 169.905. That'd be a traffic stop, and that's in the traffic codes. Did this bill get a hearing in transportation?
Representative Petersburg.
Thank you, Madam Speaker and Representative Novotny. No, which is a little surprising because we did hear other bills in regards to that about other traffic stops, but that specific language we did not hear. And I'm going to anticipate that you're wondering why, and why is that important, and why is it important that this piece in this bill should have some additional hearing and vetting out. And it really gets into the integrity of not only this room in here and the people around it, but also the integrity of all of us. It's a process issue, and Chair Hornstein will let you know that I tend to be very specific about process and following the rules that we have, and we have many times we've discussed what is the right thing to do. And when I look around this body, I have great respect for each and every one of you in there. I have respect for this particular chamber as well, and it's everything that we do, all the rules that we have about process and so forth is about building trust, integrity with the people out there in the general populace. And it's important for us to know that we continue to hold that up. It's the reason why we don't allow impugning in motives and why we don't do a lot of other things. We don't allow that because we want to uphold and keep ourselves to a high standard and high level of competency and respect by the individuals out there. It's the only way we can gain trust by the public so that they will continue to allow us to do our job. And one of the things that I've come to realize is over the last few years is that we have started to become a little bit more lenient on some of our rules and processes. And what I will tell you in my life's experience is that the respect that you're given and the integrity you have is not dependent upon when you follow the rules when it's easy. It's about when you follow the rules when it's tough, when it costs more of your time, when you really don't have the time to do it, when it's just difficult. Many times in my life, I said, well, I need to do this, but boy, I'd rather not, but I know I need to. It's just the right thing to do. This is one of those times in which here we have a process in which we're supposed to have each committee that has a certain responsibility over certain statutes are supposed to hear the bills that pertain to it. In this particular case, we have a traffic stop about violations. We heard some bills for it, but not this particular one, did not come through transportation. And it's not about whether or not it's a good bill or that it would pass through the transportation. It's about whether or not we're going to hold on to the transparency of what is supposed to happen. Because if we don't do that, then people start asking, well, they didn't follow the rules there. What aren't they also following the rules about? And so for me, this is a whole lot more about the process and what should be done and what we should hold ourselves accountable for than it is about whether or not this is a good portion of the bill or not. I'm going to let Representative Otney talk more about why he thinks it's a good or bad portion of the bill. I'm here saying this is what we should hold each other up to, which is a high level of integrity and respect, and follow the processes when it needs to be done, and let the chips fall where they may, but at least we can share with ourselves that we're doing everything right. It's the very reason why we have rules, why we'll have procedure, because those rules and procedures are a guide for all of us to use, not just some of us, not just a few of us. And yes, I know the Speaker has opportunity to rule one way or another, and we can uphold that or not. The point, though, is what are we going to do internally? How do we feel about it? Why should we or should not do it? So in answer to your question, Representative Otney, this was not heard in transportation, and I think it should have been.
Representative Novotny.
Thank you for that answer, Representative Petersburg. Moving on to the second part of my amendment, it discusses the task force that we're going to set up and do working group on different ways to pay motor vehicle registration tax. So in the past 4 or 5 years, there's been a substantial decrease in the amount of traffic stops that have been done for several reasons. Some of the bigger cities, less than half of the officers are available to do these traffic stops. And for fear of prosecutions in amendments that we'll be speaking with shortly, people are hesitant. And since traffic stops are way down and enforcement is way down, one of the things that has been observed in especially the more densely populated areas is that people aren't paying for their tabs. This is concerning to me as someone who did law enforcement before insurance was mandatory, and I saw the effects of people that would be hit by someone without insurance and all the things that would be associated with that. The Minnesota insurance mandatory on your car and having no-fault insurance is good, but if the other owner doesn't have anything to go after, your insurance company is still going to end up eating the bill. One of the major obstructions for people getting the tabs, because the tabs are cheap, depending on what you're driving. If you're driving an older vehicle, if you're driving a new vehicle, it's obviously a lot more. But if you're driving an older vehicle, the tabs are cheap. It's the insurance that's expensive. And if you don't have the proof of insurance, you can't get the tabs. Going back to my meltdown the other night, once again, thank you for everyone for having patience with me on that. But I talked about the lowering of the bar, and this is an example of lowering the bar. Instead of expecting people to pay for their tabs, we'll just figure out a different way to do it. We'll create a whole nother bureaucracy. We'll probably have to have a commissioner. We need more government, as opposed to just expecting people to follow the laws. If you don't believe in modern humanity, you've never driven on a 2-lane road. So you must have your faith in your fellow man. There's some social constructs we're all supposed to follow. If you don't stop before going through a controlled intersection because you assume that everyone else will obey their red stoplights because you've got a green stoplight, you've got faith in your fellow human, right? If you're on a 2-lane road, you expect them to follow the speed limit, you expect them to follow the rules of the road, you expect them to have insurance. One of the ways that is done is through the tabs. So instead of expecting people to follow the socially accepted norms that we have, we're just going to lower the bar. To me, it's the soft bigotry of low expectations. Lower the bar, lower the bar, lower the bar. We'll do something different, as opposed to just following the social contracts that we all have. Now, we've got $133,000 to come up with a study on how we're going to get around enforcing tabs. Now, I don't know, there's something that I'm sure I'm going to be explained here why we don't want to stop cars for having expired tabs, because that might be a good way to find out if they've got stolen plates. It might be a good way to find out if the plates are, or the vehicle's stolen. Who knows? Well, we're just going to ignore stuff. We're going to put on the blinders and ignore that it's all good just so that we can avoid some of these situations. Minnesota State Patrol, some of the larger departments in this state stop thousands of cars a day for various violations. And the percentage of those things going as they are supposed to, the driver pulls over to the side of the road, there's an exchange of information, there's a warning or a citation, or based on things, once the driver gets pulled over, there might be an arrest based on either what the officer discovers or what the officer is told. Maybe the person pulled over for a simple traffic violation or expired tabs turns out to have a felony pickup order for domestic assault or a restraining order violation, or they know that they're sitting on a firearm, or they're sitting on pounds of marijuana. We've seen multiple homicide investigations solved in this state by a simple traffic stop for equipment violations, which led to a search, which led to discovery of a firearm, which led to a forensic examination, which solved homicides. And we can keep doing that, and we can solve homicides. And by solving one homicide, you prevent the next homicide. Or we can keep putting our blinders on. I suggest we take the blinders off and we follow their social constructs. And with that in mind, I repurpose that money that would be just for a working group and would just lead to a suggestion, which would then lead to who knows whatever administrative solution to the problem that's not a problem if everything else was followed. But if we take that money and put it to something good, there's a program in Minneapolis. It started by Don Samuels. It's called Lights On. And I believe, what's the bill? Representative Tabke's got the bill 5075, which I understand is getting some funding. But what the Lights On bill does is it gives the officers a chance to give a voucher to the operators of the vehicle, and then they can take this voucher to a mechanic and use that to get their vehicles fixed, which solves two problems. One, it gets the equipment violation fixed, and there's safety, and equipment violations they're there for a reason, okay? Headlights out, motorcycle season's coming up. If you got a vehicle with a headlight out, you don't know if it's a car or a motorcycle. If it's a vehicle that doesn't have taillights at work, that's something that should get fixed. Smashed windshields, that is all covered, and the Lights On program can help with that. And that's where I feel the money should go, would be about a 10% bump to what they're getting for the Lights On program. But that's money that's good. That's money that'll help. And it'll also make a good contact, and it'll make for a positive interaction with law enforcement. And the people will not be mad. I would hope that this program, either way, I support it. I'm a co-author on Representative Tabke's bill because I think it's a very good idea, and it's a good process. And that is my vote, and I ask for your support.
Discussion. I recognize the member from Hennepin, Representative Frazier.
Thank you, Madam Speaker. And Representative Novotny, I appreciate your preview of an argument for a discussion that we may have in future years around traffic stops. This bill doesn't do any of the things that you're attempting to address today. It doesn't stop officers from pulling folks over for those safety issues. It doesn't do that. What this bill does, it does allow for the task force to get together to discuss how we can allow for people to pay for those registration tabs, which is an issue right now. There are folks right now where we may have an issue collecting those registration tabs. We want to find a way to be efficient and effective when we capture those registration tabs. That's important. Not to mention, we've had officers on multiple occasions say they'd like to get out of the tax collection business. I think we can find a way to get there, and we're doing it in a thoughtful and I believe an appropriate way by bringing all the stakeholders together to have that conversation, and we need to provide funding to allow for that to happen. And you mentioned that Representative Tapke is carrying a lights on bill. He is, and there's $1.2 million that are going to the funding of that initiative, and I think that is sufficient. This $133,000 for this project to deal with the registration fees is appropriate, it is needed, it is what is told that we need to have this conversation and come up with a plan for that. So I'm going to ask for a no vote overall on this amendment, but I wanted to explain why for that particular piece. Now, to your language in regards to an officer pulling someone over for a stop, which is limited to 168 and 169, which is equipment violations, all we're asking is that when you approach that vehicle, the officer, all you have to do is not ask the individual, why did I pull you over? Or do you know why I pulled you over? We're asking you not to ask someone to make a self-admission. I think that brings the temperature down when you have those engagements. I think this is low-hanging fruit. I think this is something that we should all get on board with. I think that this is something that can go a long way in helping to build those community and law enforcement officer relationships. I don't think this is a negative thing. I think this is a positive thing. Also, what we know is in other states where they have implemented this law, places like Rhode Island, Maryland, Connecticut, and California, we've either seen a significant drop in deaths of motorists from interactions involving those stops, or we have seen that those deaths have been eliminated altogether with the implementation of laws like this. I don't think this is a problematic thing. I think this is a positive thing. I think this is the way we need to go, the direction we need to head into. It's almost odd and surreal that every time I stand up and we're having this conversation in public safety, that I have to continue to remind us as a state, as a legislator, we are still responding to some very tragic situations that have happened in our state when it comes to traffic violation stops. We're still responding to those things. And it is up to us to continue to respond in a way that is proactive to ensure that we continue to eliminate or strive to eliminate those interactions from escalating to a way where we are losing lives. So Representative Novotny, when you say we are trying to address a problem that doesn't exist, I reject that assertion because we are absolutely trying to address something that has been tragic after tragic situations in the state of Minnesota. If we can save lives, we should be taking the task and meeting the moment to save those lives. So for all those reasons, I am recommending a no vote on this amendment. Thank you.
I recognize the member from Isanti, Representative Johnson.
Madam Speaker, Representative Novotny, thank you for this amendment. Dealing with the issue of the stop itself, I'm going to explain something that happened to me while I was working. Now, everybody knows the tabs on your cars are a different color. It corresponds by year. I met this car, if I remember correctly, it was a 1982 Ford Crown Vic LTD. The tabs were almost a year expired. I could tell that by the sticker, by the color. I think it was just over a year expired. So I turned on it, caught up to it, ran the plate, and pulled it over. I got the information on the vehicle back, and it belonged to Bonnie and Melvin, good friends of mine from church. The interesting thing, neither one of them was driving it because they were in Florida over the winter. They were snowbirds. Went up to the driver, asked for his identification, and just asked him why, or if he happened to know why I pulled him over. So he said, I have no idea. So I explained to him, I pulled you over because your tabs were expired. Do you happen to have insurance? Once I got up there, I recognized the name on the driver's license. The individual that's been dealt with many times with the sheriff's office. First time I've had dealings with him. Took and went back to my car, radioed another officer who went and checked Bonnie and Melvin's residence. They found the basement door kicked in. I happened to have Melvin's phone number, called him up, and he said nobody should be using the car. What it was, I just stumbled across the burglary. Had the suspect, had their car, and in the trunk, after redoing the inventory, found a lot of property that belonged in the house. Now, every stop is different that we do. It might be when we deal with them, once you have the car stopped, you walk up, you might see something in the car, you might notice something. Everyone is different, and it changes how you react to the person in the car. How are they reacting at the stop? Are they fidgeting? It's all different things that officers are observant to make sure that they are safe and the person that's in that car is safe. Now, Representative Frazier talked about some unfortunate incidents that occurred. Every one occurred because of the reaction the individual decided to do. If they cooperate, guess what? Usually nothing happens. But when you don't cooperate, that's when things can go south in a hurry. Officers detain the person just long enough to do their job. They don't want to detain them for a long time if they don't have to. Generally, they don't want to have to bring them to jail, but it's because of the actions of the perpetrator that causes them to go there. So thank you, Representative Novotny. Taking a tool out of the toolbox doesn't help law enforcement. In fact, it hurts, and it hurts the safety of the public. Now, with this task force that's being set up, I can tell you why tabs aren't being paid. Minneapolis alone is down about 50% of their officers working. They don't have time to even do traffic stops. When I drive in Minneapolis, I've got to the point when I have a green light, I still stop to make sure nobody's coming through the red light. I slow down at every intersection because I don't know who's going to blow through the stop sign. And I've had it happen to me numerous times when I've been driving over there. It's happened over here in St. Paul. The attack on law enforcement has to stop. It's not helping. So Representative Novotny, thank you for this amendment. I've seen how that voucher system works. It works great. The more positive contacts officers can have, the better it is for the public. The better it is to have good conversations, positive interactions with the public. It makes things work better. So thank you, Representative Novotny. Please support this amendment.
Further discussion. I recognize the member from Wright, Representative Hudson.
Thank you, Madam Speaker. We seem to be dancing around the particulars of what we're talking about when we talk about what happens at a traffic stop, whether it's for a light out or because someone's tabs are expired or whatever the cause may be. I heard Representative Frazier say, and hopefully I heard him correctly, and I'm not misquoting him here, that the implementation of this policy, which, just to be clear, throttles how an officer may engage with a subject at a traffic stop, that the implementation of this policy in other states has resulted in, as I believe he phrased it, fewer deaths of motorists during encounters with law enforcement that have escalated. And it's an interesting little rhetorical dance that evades some crucial details. If a situation is escalating to the point where lethal force is being deployed by an officer, the subject has become a little bit more than a motorist at that point. They're a suspect, and they're likely a suspect who is defying lawful orders and not complying with the officer. That's how the escalation of use of force works. I mean, unless we're suggesting that police officers are just cold-bloodedly shooting people at traffic stops for no reason without any lawful justification, if that's the idea, which I don't think it is, then we need to have a different conversation. But in the context of what we're discussing today, if somebody's being pulled over and if there's an escalation in the use of force, it is because there's a lawful sequence of events taking place. Perhaps it was discovered that the person was engaged in some other crime unrelated to the traffic stop. Perhaps it's discovered that the person has a warrant out for their arrest or to be detained. And they are ordered to comply. They're ordered to get out of the car. They're ordered to do this, that, or the other thing, and they refuse to comply. That's the source of the escalation. And so what I think is missing from the picture of looking at other states, and I'm going to take the data claim for granted, that there's been a reduction in escalations in states where this policy has been adopted. What I would suggest is that what's actually happening there is that subjects who should be getting detained, subjects who should be getting arrested, subjects who are engaged in criminal behavior are getting away without being found, without being detected, because of the throttling that's been placed, the oven mitts that have been put on officers engaging in traffic stops. It's not a good policy. We want our laws to be enforced. We want folks who have arrest warrants issued for them to be found and to be detained and to be processed. We want criminals off the street. And those of us who are not criminals don't have anything to worry about when we get pulled over and asked, do you know why I pulled you over? You're not engaged in crime, you don't have a warrant out for your arrest, you engage with the officer respectfully, you're gonna go home. And that really is, as it's been discussed in committee and as we're discussing it here on the House floor today, the underlying intention as expressed, I'm not speculating, as expressed in committee, is exactly that, to reduce encounters with law enforcement, to reduce incidents that could potentially escalate, as if the contact with the officer is the reason for the escalation. And that's simply not true. I mean, if that's what we really believe, if we really believe that contact with law enforcement is the reason for escalations, then perhaps we should just get rid of police officers? Interesting alternative theory. In reality, the reason for these escalations is because the subject is not abiding by lawful orders, the subject is engaged in criminal behavior, the subject is being dealt with lawfully and is refusing to cooperate, and that is what escalates the situation. It is the criminal who is the source of the problem here, not law enforcement and not current law.
Further discussion. The member from Hennepin, Representative Fraser.
Thank you, Madam Speaker. I feel like we're debating about a bill that's not before this body right now. We are not saying that you cannot stop folks for these traffic stops. We are merely saying that you can't ask an individual why you're being pulled over or why did I stop you. I don't know why this is such a controversial thing. And the data is clear from what I said around the states that have put this in place already. And just to this whole idea of compliance. Again, in a state where we've had such tragedy, we're talking about something that we know individuals were complying, and yet we've had to have vigils for those individuals. Philando Castile was complying. In fact, he did exactly what he was told he should do in a situation like that. And yet, he was murdered in front of his girlfriend and a child. That is what happened. So we have to stop it with this comply and you'll go home. We know it is not true, specifically for men that look like me. We know it's not true. Vote no on this amendment.
Further discussion. I recognize the author of the amendment, Representative Novotny.
Thank you, Madam Speaker. Well, part of the concern is that we saw what the language was in the don't ask language when it started with, and the fear of what it'll become next year. I fear that police officers, for the fear of misstating something when they walk up to the car, won't do the job. Little birdie dropped off a statistic for me here. In 2022, St. Paul Police Department records show that 61 illegal possession of firearms convictions were due to pretextual traffic stops. 61 guns resulted in convictions. 61 guns were taken off the street by someone that was not supposed to have a gun. My fear is that those stops aren't going to happen anymore. My fear is that drivers with no insurance will continue to rage. That's our fear. And since you're recommending a no vote, Madam Speaker, I request a roll call.
Seeing 15 hands, there will be roll call. Representative Novotny.
Thank you, members. This is a good bill. This is a bill that would make Representative Moller's public safety omnibus bill all green in the future when we take the final vote. Thank you.
The clerk will take the roll. The chief clerk will call the names of the members voting remotely.
Carroll.
Carroll, no.
Carroll, no.
The clerk will close the roll.
Madam Speaker,
Representative Novotny.
I move to refer this bill to transportation. What's that?
Representative Novotny, we're in the middle of roll call right now. All right, the clerk will close the roll. Now, there being 60 ayes and 68 noes, the amendment is not adopted. Representative Novotny.
Madam Speaker, I I move that this bill be re-referred to transportation so that this bill could be properly vetted. And I request a roll call on that.
Seeing 15 hands, there will be roll call. Representative Novotny moves for the bill to be referred to public safety? Committee of Transportation. Members, just to reinstate the motion, Representative Novotny moves to re-refer the bill to the House Committee of Transportation, Finance and Policy Committee. Discussion. I recognize Representative Moller.
Thank you, Madam Speaker. I'm going to recommend a no vote on this. This bill was vetted, and this particular language was vetted twice in the Public Safety Committee. We also had the grace of Chair Olson when we heard this bill in the Ways and Means Committee, and based on questioning from the other side of the aisle, we had an oral amendment at that time to even improve the language further. We have never heard that anybody wanted to hear it in transportation. It's never been requested before. And I find it interesting when we were discussing this language with the last amendment, somebody said, it's a non-law, it does nothing. Well, it's actually clarifying an expectation, but if it is a non-law that does nothing, I'm not sure why we're so nervous about having it in this bill now. So I'm going to recommend a no vote on that motion. Thank you.
I recognize the member from Waseca, Representative Petersburg.
Thank you, Madam Speaker, and I would recommend a yes vote. As I said earlier, it isn't about whether or not this is the right bill or that this is going to be properly vetted or that it's even going to be approved or not approved. This is about us following the process, even when it's tough and is not easy, because this is something that should have gone through transportation, whether or not anybody asked for it or not. There's a lot of stuff that goes on in other committees that I'm not aware of, and so it's important for us to always maintain the integrity of the process so that we all can have confidence in each other, that we're following the rules, and the public can have confidence that we are actually doing what we said, and they will have an opportunity to vet and have information and actually input into our decisions. So it's something that we can do quickly. We could have it done fairly soon and move forward. Thank you, Madam Speaker.
I recognize the member from Isanti, Representative Johnson.
Madam Speaker, members, I've noticed a pattern over the last 2 years. We have many bills that should go to committees that don't. Once in a while, they get re-referred off this floor back to those committees, but not very often. There's been a number of bills that should have gone to the committees I sit on because I had questions on them, but wasn't able to because they never made it to that committee, even though that committee had jurisdiction over things in those bills. Now, the chair might have been in the Ways and Means, but were the other members of the Transportation Committee on both sides of the aisle in Ways and Means so they could ask questions about this? No. It goes to those committees because that's where that committee has jurisdiction to really vet that area. Now, 168 is in the Transportation Committee. It didn't go there. If we don't follow our rules when it's easy, how are we going to follow them when they're hard? And if we don't follow the rules that this body set, there's no reason to have any rules. And if you don't have rules, just like if we don't have laws, it's anarchy, it's mob. So I think it's time to start following the rules of this body, or we can just throw the rule book away. Send this back to transportation.
Further discussion. Seeing no, Representative Novotny, seeing no further discussion, the clerk will take the roll. The chief clerk will call the names of the members voting remotely.
Carroll.
Carroll, no.
Carroll, no.
The clerk will close the roll. There being 59 ayes and 69 noes, the motion to re-refer does not prevail. There's another amendment at the desk. The clerk will report the amendment.
Nash moves to amend House File Number 5216, the second engrossment as amended. The amendment is coded A15.
I recognize the author of the amendment, Representative Nash.
Thank you, Madam Speaker. The A15, members, is an amendment that came out of a news story in KSTP on May 1st. You might have seen it. And it is a Minnesota 911 manager that was living in Virginia that there were some problems that resulted around that. And the gist of the amendment is that we should have emergency workers for the Department of Public Safety living in the state. Now, I will go on record. I will tell you that I believe in remote work, and people who are not associated with something along the lines of an emergency management system or emergency, if they want to work in somewhere else, that's fine. If you work in a back office job, if you're in charge of making reports or processing things, great. If it saves the state money and does the same work, that's fine. However, if we are talking about a person that works in our emergency management system, I think we could all agree that they should live in the state of Minnesota or directly adjacent to it. Like in Wisconsin, if they live in Hudson, okay, I get it. They're taking advantage of the low taxes over there. And I think that what we should look at is what is the response time of somebody who is tasked with marshaling people or responding quickly to something that needs responding to. And the pages are passing out, I believe, the report or the KSTP piece. Again, I support remote work, but not in an emergency management situation. And I just want to be clear, the employee was never accused of violating any policies, but I think the policy needs to be changed. Because again, it just makes sense that if we have an emergency here in the state of Minnesota that requires their attention, they should be able to report quickly to, we'll call it the mothership or headquarters. So if something goes sideways, they should be able to hop in the car and be here within a reasonable amount of time. And that's what I'm trying to get done. And I think that if you liken it to what we heard in the Public Safety Committee, I don't know, Representative Rarick can correct me, but when I was on the Public Safety Committee, many of you advocated for police officers living in the policing district that they were working for, because you wanted them to be present and you wanted them to be able to respond quickly and be a part of the problem solving that was going on there. So it's a very straightforward amendment. It doesn't have any fiscal implication that I know of. And I think that the primary place in the line 1.1, primary place of employment, is here in Minnesota. I think that if you're an emergency management manager or employee, you should be in the state of Minnesota. Thank you, Madam Speaker.
Discussion. I recognize the member from Ramsey, Representative Moller.
Thank you, Madam Speaker, and thank you, Representative Nash. I think what you're trying to accomplish, while I understand it, creates a really broad, you paint with a really broad stroke here, because your amendment isn't limited to just emergency communication managers. Your amendment deals with all employees of the Department of Public Safety, which has almost 2,300 employees. A large percentage are not first responders and don't have emergency response duties. Those employees at DPS, I'm told, that have such duties are required to be located within a certain geographic area according to their position. I'll also note that certain members of the Department of Public Safety, certain employees have to be sent out to other locations of the state to do their job. I personally experienced that when I handled some cases, criminal cases, when I worked at the Attorney General's office, and there were homicides in greater Minnesota. The BCA often has agents that will go and actually, some of these homicides can take weeks to prosecute, and so you basically set up camp in these jurisdictions during the trial. And the way your amendment is worded, it says not only must they have a primary residence within Minnesota or a bordering state, they must be able to report to their primary place of employment within 1 hour of notification. Well, that would be impossible for some of those staff members of Department of Public Safety who are on location. I would also note too, this hour away for other employees who aren't necessarily in an emergency response scenario. Many of these employees might have their headquarters here in St. Paul. They actually might live in your districts and be outside of an hour away. And so you would be saying basically that they could no longer be employees of the Department of Public Safety. So unfortunately, Representative Nash, for all those reasons, I'm going to recommend a no vote. Thanks.
I recognize the member from Isanti, Representative Johnson.
Madam Speaker, Representative Nash, thank you for this amendment. If you work in law enforcement, you have to have a reasonable response time from where you live to where you work. Now, Representative Mueller brought up the fact that BCA agents are sometimes could be anywhere in the state working a homicide. Guess what? That's where assigned work area is. They're going to be there, especially if they have to stay in a hotel, because they're working there. That would qualify. They could be assigned anywhere in the state to help out our local law enforcement officers or working on a case of their own. But that's their assignment, so that they'd qualify. But when we have emergency management directors for the state living halfway across this country, and there's an emergency, so they have to jump on an airplane, take a 3-hour plane ride, besides being at the airport at least 2 hours ahead of time to get on a plane, drive into the airport, you're looking at 6 hours, 8 hours before they get on scene of an emergency. That long a time frame, it's not an emergency. So I think it's important that they live close to the area and not halfway across the country. Please support the Nash amendment.
Further discussion. I recognize the author, Representative Nash.
Thank you, Madam Speaker. Members, I think that Representative Johnson makes a good point that if you are to be part of the response team, that you should be very close. And I did take some time and spoke to a friend of mine who deals with crisis and emergency management, and their professional opinion was that that deployable asset, we'll just call it that way, that the deployable asset really should be in the area. And I think that I understand the argument from Chair Moller, I do, and perhaps when we're in charge next year, we can work on it together. I don't want to go down the road that Representative Robbins did last week and give you guys the majority for next year, but I'll promise to work with you next year on this. But we could still do it today, and I would encourage a yes vote.
Seeing no further discussion, all those in favor of adopting the amendment say aye. Aye. Those opposed say no. No. The motion does not prevail. The amendment is not adopted. Representative Nash offers the following amendment. The clerk will report the amendment.
Nash moves to amend House File Number 5216, the second engrossment as amended. The amendment is coded A12.
I recognize the author of the amendment, Representative Nash.
Thank you, Madam Speaker. The A12, well, if you're not aware of the Trooper Lonergan situation, maybe you don't watch a lot of television or read the newspaper or a lot of other things, but the A12 is an amendment that would, as it says on line 1.9, take $133,000 in fiscal year 2025 and move that to the Attorney General in order to give the Attorney General's office necessary resources to handle the case that has been filed against Trooper Lonergan. Now, further down, you'll see that if Trooper Lonergan, if the charges are dismissed, that any unencumbered amount of that money can be sent back to the general fund. And here's why that's important. Because he's innocent. And we have been told again and again and again and again, I think that's 4 agains, because 4 use of force experts have said that this was a justifiable use of force that Trooper Lonergan used in protecting both the public and his partner. And what we have seen is a very activist county prosecutor making this, I think, very difficult for the trooper family. And I would also say that for the governor, because the governor had said on a number of occasions, and this is in a Fargo radio, KFGO, Fargo, in an interview, he said, this is Governor Walz quoting directly, "A request could have been made to the Attorney General, Keith Ellison, for help," Walz said. "A request could have been made to the Ramsey County prosecutor for help. A request could have been made to anyone. That is a normal procedure to ask. Those requests were not made." Members, I think it's super important that we recognize that when somebody like Trooper Londrigan puts on that uniform to go and protect and serve and fight to keep people safe, including their partner, that in a situation where we are taught to run away from danger, they are taught to run towards it. And when 4 use of force experts say that this was a justifiable situation, why are we not listening to the experts? Why are we not saying 4 use of force experts have made it very clear that Trooper Londrigan is innocent? A good number of our members have served in law enforcement, and they have been asked to do very similar things. They have been asked to put their life on the line. They have been asked to defend the public. They have been asked to defend their partner, to stand in the way of harm. What we are seeing is, in my estimation, a very broad and inexplicable reason for pursuing this case. What we learned recently, too, is that there is now an outside law firm that has been hired at a minimum, a floor of $750,000 payment guaranteed before, the agreement reads that if once it goes past or is bumping up against $750,000, they will have to come back and ask for the ability to spend more money. The blended rate of these extra prosecutors is $850 an hour to prosecute a case where the use of force experts, 4 of them, have said this was a justifiable use of force. So I would hope that today, as we are here, that we would listen to experts. Use of force experts, and I know that Representative Novotny is going to talk a little bit about what is a use of force expert, what do they do, how do they evaluate these things, and what does it mean when they say that it was a justifiable use of force when they make that report. Members, Trooper Londrigan has done his job. And I know I saw a good number of you at the Burnsville funeral for the 3 first responders. They were doing the same thing. Trooper Londrigan defended the public. Trooper Londrigan defended and protected his partner. And sadly, Hennepin County Attorney Moriarty has decided to push this and push this and push this, even against the recommendation of use of force experts. I can't understand that. You know, up here at the Capitol, we have experts come in regularly and we hear them testify in committee, or we get their opinions submitted by a letter, or we listen to them as we are building and crafting legislation. I know that the voice of an expert here at the Capitol carries weight. 4 experts, 4, have said that this was a justifiable use of force. I don't know how we walk past this. I don't know how we avoid this. And Madam Speaker, I know that there are some other members that would like to speak to this, so I will be done now. But the trooper is innocent. Let's make sure that we recognize that here today. Thank you, Madam Speaker.
Discussion to the Nash Amendment. The member from Sherburne, Representative Novotny.
Thank you, Madam Speaker. Representative Nash, under normal circumstances, I would take great joy in telling you that you're wrong, because you're wrong. But I will not celebrate that based on the circumstances that we have. Representative Nash, it's been 7 use of force experts and trainers that have been involved in this. 4 from the patrol, 2 the defensive hired, and never forget the use of force expert that was brought in by Hennepin County to start with. I believe his name was Nobles. And if you'll remember, that's the same use of force expert that Hennepin County brought in as a hired gun several times to testify in other cases. And since he had sided with the prosecution in those cases, he was brought back for this one. And when he said that the charges and did not, that the situation did not rise up to a level of being charged in violation of Minnesota state statutes, the very statutes that we fixed and put together ourselves in the last session. So it's 7 use of force experts. But let's talk about the money. So $133,000 that we could have available for the Attorney General's office if we do this. Breaking it down, the average Hennepin County attorney, the top Hennepin County attorney, I would assume they'd have the most senior, most experienced attorneys working for them, $155,000 a year. Kind of to put it in perspective for you, what the I would assume I would assume the Attorney General's office lawyers would be maybe in the same ballpark, maybe a little more. Putting that in numbers against what the step-toe contract is for the hired gun prosecutors out of Washington, D.C., that $133,000 for 2 attorneys at 40 hours a week would last about 1.95 weeks. That's not considering travel. That's not considering lodging. I will give the Hennepin County Board an award for fiscal responsibility. They will reimburse step-toe for a coach flight, and they have to take light rail from the airport to their lodging, or that's their reimbursed rate. Because I can see a hired gun lawyer from Washington, D.C. riding the light rail from the airport to wherever they're going. There will be other people talking about this, but I will give you a situation that I was involved in when I was assigned to the range, and I was a full-time trainer at the time, use of force instructor, firearms instructor, and we had a situation where there was an individual who was stopped by a member of the State Patrol, and one of the county officers stopped to assist him. And there was a long exchange at the door where it was determined that the individual was under the influence of something and they wanted him to get out of the car. Now, I don't know what the initial reason for the stop was. I don't know what the initial conversation for the stop was. Now, the back window of the vehicle was broke out when he was pulled over. So I don't know if when the trooper walked up to the car, if the trooper asked him if he knew why he was being stopped. And, well, I guess I could go back and listen to the tapes. But it really didn't matter. It really didn't matter because that's not when things went sideways. That's not when things went sideways on that traffic stop. That's not when things went sideways on all the other traffic stops that we are talking about in the previous bill and cited by Representative Frazier. That's not what we're talking about. If there was one case where someone walked up to the door and said, "I'll get back to the case," I'll get back to the amendment that we're talking about. What we did when that situation, oh, I forgot to finish the story. He was very drunk. He'd already been in a couple crashes already. That's why his window was backed out. And they didn't want him to drive away because they were fearful for the other people in the area. So they said the magic words, "You're under arrest," which I could be wrong, but the words "you're under arrest, get out of the car" were mentioned in just about all the other cases that we're trying to fix that wouldn't be fixed by the legislation that we're proposing to fix the legislation. And he said, bleep, put the car in drive, the truck in drive, and attempted to drive away. And the troopers and the deputy attempted to stop him. And the trooper was dragged down the road. And after about 100 yards, and I know this because he had a body mic on, he informed the individual that if you don't stop, I will bleeping kill you. And he accelerated. So he took the actions that he needed to stop this deadly force situation. We looked at the incident, we took the Minnesota state statutes, we took our training manual, we took our policy manual on use of force, and that was just squad cameras. All we had was the audio and the squad cameras. We didn't have the body-worn cameras. And the county attorney looked at this and said, this is clearly a case where deadly force was authorized. And that was it. We didn't have to spend $2 million by the time that we're going to get done with this case. That's what their average billing is on one of these hired guns cases. Isn't that the number represented? 1.9 million? Yep. So we've got a case. Representative Moller herself referenced the fact that she's participated in homicide investigations. Conflict cases, I don't know what it was, or just an expert case. Hennepin County Attorney's Office handles, 75, 80 homicide cases a year? And they can't handle this one that's videotaped from 3 body cameras and 3 squad cameras. And we're talking about 3 seconds worth of time that we have to decide was the proper use of force applied at the proper time, not who did who to what when. This is not a whodunit, guys. Not a whodunit. I believe that the county attorney's office, if they can't do it, should send it to the state attorney general's office. And I would almost guarantee you that there's someone at the attorney general's office that would be able to review Minnesota state statute and state patrol policy on use of force, and we could get this done. Members, I ask you to support Representative Nash's amendment. It's a very good amendment, and it makes a lot of sense for the taxpayers of Minnesota.
I recognize the member from Crow Wing, Representative Davis.
Thank you, Madam Speaker. I have a vested interest in this as I have family members who are in law enforcement, and I know it takes a lot of bravery, a lot of courage to put your life on the line to protect Minnesotans. And at times, those law enforcement officers have to protect themselves and their partners, the people they work with. And I think it's time for the Attorney General or the Governor to act and to come to the aid of innocent law enforcement officers who put their lives on the line and find themselves coming under attack in Hennepin County. This is a witch hunt, and it appears that law enforcement can't get a fair shake in Hennepin County. So here's an opportunity for us right now to send a message to the governor, to the attorney general, and I hope they do act, to help preserve sanity when it comes to protecting our great, courageous, brave law enforcement officers. As it was already pointed out, thank you, Representative Novotny, for pointing that out, that State Patrol trainers said that Trooper Londrigan acted in accordance with his training. Hennepin County Attorney's own use of force expert said that Trooper Londrigan acted reasonably. Their own use of force expert. He acted in defense of another state trooper, and thank God that he did, or else we could have been attending another funeral for our great law enforcement. I won't prolong this, I just wanted to say it. He acted lawfully to protect. Now let's act on this floor to protect him. Please vote yes on the 812 amendment, members. Thank you.
I recognize the member from Wright, Representative Hudson.
Thank you, Madam Speaker. We have a responsibility as public officials, as literal representatives of our constituents, of the people of Minnesota, of the state of Minnesota, to stand by our law enforcement officers, and certainly not to demonize them, as has been a pattern for several years. And, you know, when we discussed a previous amendment, reference was made to a high-profile police encounter where use of force escalated, and there was an officer-involved shooting that resulted in death. And we hear reference to these sorts of stories all the time, and they're highlighted as if they are indicative of the norm. This is what always happens. It always goes down like this. Except it doesn't at all. In 2022, just in this city, just in St. Paul, there were 12,903 traffic stops. 12,903 that didn't all, or even mostly, or even substantially result in escalations to officer-involved shooting, or fatality, or lethality. When I say that compliance is the responsibility of the subject, when they become a suspect, when they've received a lawful order from a law enforcement officer, that's just obvious. And in virtually all of these situations that get pointed to and highlighted as examples of why law enforcement as a profession is so suspect that we have to put oven mitts on them and throttle their ability to engage with subjects, engage with the public. We have to reduce contacts. When we do that, we're defaming an entire profession and every single officer who engages in it. And there's an opportunity here with this amendment to take a significant step in the other direction, to say, you know what? We're not going to prioritize reducing contacts and spend money on that. What we're going to spend money on is sending the very clear message to radically out-of-touch prosecutors, that you need to follow the evidence when you're considering a prosecution or you're trying to engage in a prosecution, and not unfairly defame and persecute through prosecution our law enforcement. Vote green.
I recognize the member from Dakota, Representative Whitty.
Thank you, Madam Speaker. Thank you, members. I speak often in this chamber about the initiative to support our law enforcement 365 days a year. Unfortunately, on this case, Mary Moller has created a mess. And this is just not me and the public and everyone else. This is other county attorneys and attorneys that have talked about this. Moriarty has shown her bias against police, and that someone independent of her office should be looking at this case. She's created such a mess that there's no way to move forward without an expert witness. And as we heard from Representative Novotny, there's been 7 and 2 from the defense side. This is not fair for either side of this case. In Hennepin County, you put your resources in the most important cases that are high profile. And throughout the state, I don't know if there's a higher profile case currently. Well, maybe there's one more higher profile case. But in Hennepin County, there are 140 attorneys. You remove your resources and put them onto the cases that are most important. That is why Mary Moriarty has so mishandled and complete mess of this case. She had some opportunities to take it to a grand jury to determine if the force was necessary. She had the opportunity to ask for assistance, and why she hasn't asked another county attorney, maybe from Ramsey, Anoka, Dakota. And why are you not referring it to the AG's office? Recently, in a Star Tribune article, Governor Walz, who recently expressed concern about Moriarty's handling of this case, actually told reporters that he does not see how outside legal counsel as a positive development, calling the decision somewhat unorthodox. It seems to him a well-funded and robust office like the Hennepin County DA should be able to handle this case. The rule of law matters. And Minnesotans are looking at this case. Our law enforcement puts those uniforms on and are asking for our support. They need the strength to go out there and do their job. What I would tell Governor Walz right now is we need leadership. We need real leadership, and I'm asking for the Governor Walz to make a decision. If there is a conflict with the civil side of this, with the State Patrol, he has said in the past that they can build a wall. And if there is a conflict, let's trust in our AG to make that decision, to go outside and look at possible retired prosecutor and independent investigator to handle this case. I had the opportunity to go to state troopers' graduation. And the colonel spoke about a family, but a teamwork and how they work together. Each day we walk through this chamber and the state troopers are out there protecting us. But this has an effect on them too, because they're out there putting that uniform on. And I think this amendment would give us an opportunity to least show some support for our law enforcement and let it go the way the courts need it to go. But it's time for a fair hearing, and I ask that you guys support this amendment, not just for Trooper Longren, all the state troopers, all the law enforcement officers that are putting those uniforms on every day. Thank you.
I recognize the member from Clearwater, Representative Grossell.
Thank you, Madam Speaker. Members, I rise in support of the Nash Amendment. And when you look at how things have developed, and you look at no one in the Hennepin County Attorney's Office wanting to touch this case, that should tell you something. That should tell you something. There's nothing there for them to prosecute. This is a case of Trooper Lonigan doing his job. And just like any other peace officer in the state of Minnesota or in this nation, when you have to make that decision to use deadly force, it's usually about a window of about 1 second, maybe 2. One second, maybe 2. In working in gangs, guns, violent crimes, and so on, I've had to make those decisions. Shoot, no shoot. And I only have a window of about 1 or 2 seconds. I thank God every day that I never had to squeeze that trigger on another human being. And there's a lot of officers across this nation who have been in that window as well, who are giving thanks every day that they didn't have to do that. But for the ones that do, for anyone who has never put on that uniform, who has never been put in those life or death situations, and you have to make a decision in that short of a time, in that window, don't ever judge them. You got no place judging them. Now, the high-profile case that was mentioned before, I'm not going to go into detail about that, but that officer was acquitted. That individual was not murdered. So when you say things on this House floor, you better have looked at the evidence. You better have looked and watched the videos to see what happened there. Do not tell half-truths on this floor. The Lonergan situation, it needs to be resolved. When everybody's saying, all the professionals that have been asked are telling you that he acted within his training, acted within the confines of the law, and he was placed in that few-second window to have to make that decision. We should make sure that this gets resolved in a proper fashion, and taking and giving some funding, or moving the funding to the AG's office, or getting this case heard by the AG's office is the best thing to do. Whenever these things happen, I always talk to my friends that I worked with in the past to ask them, what happened here? I don't ask for more than what they're allowed to give. But it doesn't take very long for them to figure out that he acted within the confines of the law. Support this Nash Amendment, folks. Support this Nash Amendment, and let's let's make sure that the trooper gets back to his life. A tragedy has happened, a life is lost. Nobody revels at that. Support the Nash Amendment.
I recognize the member from Anoka, Representative Ingen.
Thank you, Madam Speaker. In the Public Safety Committee, we heard a lot from our law enforcement professionals, first responders, about the need for increased recruitment and retention. We heard that they're struggling mental health, they're struggling with morale, and we can try to address that with an appropriation. We can try to address that with some legislative solution to try to ease that. But nothing will fix it if things like this, the Trooper Londegren case, continue, because it wipes it all away. It's a sad state of affairs when I'm standing here and advocating that the Attorney General's office take a case that involves a law enforcement officer. I definitely wouldn't have believed that I'd have done that a couple years back, but here I am. And that's because it's very clear that Mary Moriarty and her administration is more focused and engaged on activism than they are justice. Even with a simple Google search, you got a couple of news articles here that pop up, and there's pages upon pages of them. April 5th, 2023, County Attorney Mary Moriarty gives juvenile detention to convicted second-degree murderers. A.G. Ellison steps in to say that this plea was too lenient. Well, and then County Attorney Mary Moriarty plays the victim, ironically, and says that A.G. Ellison is acting against democracy. September 30th, in the Star Tribune, Sharice Barnett listened in disbelief as Hennepin County Attorney Mary Moriarty explained that a teenager charged in her son's murder would be spared prison. Barnett echoes a group of crime victim families who say that they feel re-traumatized by her office's actions. KSTP, October 11th. This is just in the span of a couple months, guys. Antonio Moore was stabbed to death 5 months ago in Brooklyn Center, and Demetrius Harris was initially charged with second-degree murder. Harris recently accepted a plea deal from Mary Moriarty's office, pleading guilty to second-degree manslaughter, which likely only carries a sentence of 4 years. But then he got a police officer who does their job. All of a sudden, Mary Moriarty remembers that she wants to prosecute. This is so simple, guys. So simple. Reject the activism that's going on in our prosecutors' offices. Reject it wholeheartedly. You don't have to embrace it. You can stand up for justice. You can stand up for the folks that we, as a body, I know Representative Woody brings this up a lot, we remember our police officers on the days where there's vigils and funerals, but none of the other days. Show up today. Show up today for them. I remember last summer or 2 summers ago, I was canvassing the streets in Lionel Lakes, and I had met an officer, a former officer, and he had told me a story that I think I'll remember for forever. He had said, he had just gotten done pulling a 5-year-old out of a lake, a drowned victim, and he had attempted to resuscitate this drowned victim, and after 10 minutes, there was no avail. And then he got in his squad car, drove off, and people were throwing rocks at his squad, flipping him off and calling him a pig. After he just tried to help somebody. This is what we're dealing with. This is what our law enforcement officers are dealing with. And now they have an activist, rogue prosecutor that's going to go after them simply for doing their job. Because you get a couple headlines for it. It's sad, it's disturbing, it needs to stop. And today, with a green vote on this amendment, we can put an end to it. Thank you.
I recognize the member from Isanti, Representative Johnson.
Madam Speaker, members, I never thought I'd want the Attorney General Ellison to take over a case. But this time I do. I've been in the situation where we've had to do what a lot peace officers all across the state do not want to do. And that's to have to take somebody out. I was at the scene dealing with the call for about eight or 9 hours. The last thing we wanted to do is have to take his life. When it came to the end, I was by a building that the individual was armed, randomly shooting in the air. Another officer was off to my right, and the individual lowered that firearm towards me and that other officer and fired a round off. And the officer to my right took the life of that person. It was a clean shoot, but it was hours of paperwork, hours of reports, and it still lives with me today. Many officers involved in a shooting usually don't last long on the department, ends their career because it's the last thing they ever want to do. Now, Trooper Lonergan, I'm sure he didn't want to have to do that. We have 7 experts that said he did not commit a crime. It was just a foul shoot. Even 2 of the defense or the prosecutor's experts have said that. Yet Mary Moriarty continues her persecution of law enforcement, an agenda she ran on to run as county attorney. Mary Moriarty is not doing her job. She's doing her agenda. That's not what the county attorney is supposed to do. They don't run on an agenda. They run to enforce the laws and prosecute those that commit crimes. Not to make up laws, not to decide which laws I'm going to enforce, which ones I don't. And unfortunately, she's given the other 86 county attorneys across the state a bad name. She had an opportunity to bring this case to the grand jury, which she did. But halfway through decided, oh, I'm not going to do that anymore, and ended it. I have a feeling I'm not even going to speculate why that happened. But law enforcement officers generally have a fraction of a second to make that decision that they dread having to make. I don't know how many times in my 27-year career I had my firearm out and pulling on the trigger. Thankfully, it never went off. But the situation that it was happening, it required me to start going to that point. But thankfully, in that fraction of a second, things diffused so we didn't have to. Members, it is time to end activist county attorneys and actually do what's the right thing to do. It's time to move this case to the Attorney General's office and let him handle it. Please support the Nash Amendment.
I recognize the author of the amendment, Representative Nash.
Thank you, Madam Speaker. Well, you've heard from a lot of my colleagues. Many of them are former law enforcement. Just how important it is to realize that what they do is hard. And if you've not noticed, a lot of our members do, I come up the main doors every single day and I shake the hands of the troopers and the former troopers that are here to protect us and to serve us, not for anything other than to show respect. To show the respect that I think that they are owed for the job that they do, which is to put themselves in between us and harm. And I want Minnesota to hear, I want folks who are around the world watching this case unfold to hear that, and I'm happy that Representative Novotny proved me wrong. I'm glad to be wrong in this case. 7 experts said that this was within a justifiable use of force. One last person that I hope is listening, and I respect the office of governor because he is our chief executive here in the state of Minnesota. And I would encourage him, implore him, beg him to take this case away from Attorney Moriarty. And I want him to do that, but I don't want to create, as we know, sometimes a negative vote, and I don't think this will go on to the bill, so I don't want to create that negative situation. So, Madam Speaker, I'm going to withdraw this amendment at this time because I want the governor to feel like he has backing of a lot of legislators, but not to create a negative vote. Thank you, Madam Speaker.
Representative Nash withdraws the A12 amendment.